My name is Mike McGuire, and I'm honored to be able to represent and work with all of you in the State Senate. And it is an incredible honor to be able to work with Humboldt County day in and day out and making sure that we never take no for an answer for the North Coast. And I'm also absolutely, and I'm grateful to be working with Supervisor Bass to be able to co-host this important town hall. And on behalf of Supervisor Bass and the entire county of Humboldt, we welcome you to this important community conversation on California's opioid crisis. I think that we can all agree that communities big and small, up and down the California coast and throughout our nation, are facing similar challenges that have impacted all of us here in Eureka and all throughout the North Coast. Humboldt is not alone in trying to combat this crisis. Many regions in our country are struggling with what most experts call the worst drug crisis in American history. And I think that we can all agree that there are very few issues over the last decade here in Humboldt County that has created such controversy and division among neighbors. And I can totally understand why. Whether it's needles on the street or in front of your business, the revolving door of the criminal justice system and the passage of Prop 4757, which I think is important to note. Humboldt County passed Prop 47 with nearly a 65% point of the vote, and Prop 57 with 2/3 of the vote. Or you may be feeling frustrated and angry because you or your loved one is struggling with addiction and is in need of resources and help and understanding and compassion. No matter the cause of the controversy here on the North Coast, the bottom line is that as the controversy has grown, the opioid epidemic has deepened. Now, Humboldt County has five times the overdose rate compared to the rest of the state of California. Humboldt County has 5 times the mortality rate compared to the statewide average when it comes to opioid addiction. The hospitalization rate for opioid overdoses is 2 times higher. And Humboldt County's prescription rate for opioids is between 80 and 90% higher than the statewide average. I made a promise to all of you when I was first elected to be active and involved in the issues of greatest importance to you and your families. And no matter how uncomfortable the issue may be, or how uncomfortable the conversation is, this is why we are all here tonight. And I'd like to be able to get a quick census of the room. How many of you are here because of your deep concern about the number of needles on the street or in front of your business? Show of hands. Thank you. How many of you are here because you're concerned about opioid prescriptions, both potential limits on the painkillers or because you believe they're too excessive? Show of hands, please. Thank you. How many of you are here because you or someone you know have been addicted to opioids? Thank you. No matter the reason why you're here, we're here together, and we're ready to advance solutions. And while there is no silver bullet to this crisis that has impacted rich and poor, men and women all across this country, we're proud to be announcing tonight a $4.8 million investment in the opening of a results-driven new opioid addiction health center here in Humboldt County in the coming months. The County of Humboldt will be announcing a new needle collection program that has been advanced by Supervisor Bass and the Board of Supervisors and Health and Human Services, and we need to say thank you to them. And you're also going to be hearing from the Department of Healthcare Services here in just a moment about the new opioid addiction programming set to launch across California in 2018. This crisis, though, is big, and it's one of the toughest challenges that we have on the North Coast and throughout America. But I am confident together we can do this. It's going to take coordination at all levels of government and coordination with government and private business. It's going to take tough conversations, even if we disagree with each other. It's going to take resources to treat this medical case that we call addiction. And I got to tell you, we have an all-star lineup of experts from across the state and right here from throughout the North Coast and Humboldt County. They'll have some great information for you, and we're going to be talking about advancing solutions. But the most important part of tonight is hearing from all of you. There'll be plenty of times for questions and conversations. All that we ask is that we keep the conversation collaborative and civil. And while we may take different paths to the solution, we all want the same thing, a long-term solution to this epidemic. Am I right, ladies and gentlemen? So without further ado, would like to be able to introduce our co-host for this evening. If you could please give a warm welcome to Humboldt County Supervisor Virginia Bass.
Wow, this is an amazing crowd, and I think when we first started talking about this was not what we expected, so this is great. One of the things I love about my job is I go across country or through the state and I talk to county officials from all over the place. And I realize our problems are not that much different. And so it wasn't that many years ago where the opioid addiction was become a really hot issue. And we heard from people about their issues, the problems, how we got to where we were, but there were no solutions. So it was great. We'd come home with all this information and go, I'm going to make a difference. I don't know how. And so it was really frustrating. And then those presentations changed. I don't know, sometime last year, I attended one in Ohio. And Ohio, as many people know, is kind of like the hotbed and the epicenter of this epidemic. And it was different. They were there, people were there who actually had been making headway. And so it was really interesting to hear how they did that. And it was actually pretty simple. First, the guy started off and he said, how many of the audience have had friends, family members, coworkers who have been affected by, the opiate addiction? And of course, like you guys did today, they raised their hands. And he looked at the rest and he said, you don't know it. Those of you who didn't raise your hand, you do too. And so that was kind of an interesting thing for me to hear because I hadn't really thought about it like that. And then the other thing he said is until you own it, you can't change it. And he wasn't talking about addiction. He wasn't talking about people who were addicted. He was talking about the community. And this is something we have to embrace as a community issue to really make a change because we have to be able to talk about it. And these are obviously very painful conversations, but they're necessary. So when I came back home, I was thinking I wanted to learn everything I could. And my most defining moment was when I went to Open Door Clinic, and they were kind enough to let me sit in on one of their Suboxone sessions. And these wonderful people were willing to share their stories of how they ended up, in this predicament. And the first person who spoke, he says, hi, I'm so-and-so. I went to elementary school with you. Sure enough, he's in my kindergarten picture next to me all the way through high school. The next young man with 2 little kids, he looked at me and he said, I used to work for you. How's Jason doing? How's your son? I was thinking, okay, I know this guy too. And then the next guy, next right to him, said, you used to work with my mom. And that's when the comments made by that gentleman made so much sense to me. These are people in the room who did not mean to get where they are, but they were very courageous because they're taking steps to make change. And so having you here tonight, we have to be a courageous community. We have to be willing to talk. And this is the beginning. And it's going to continue. This is not a one and done. We have made a commitment that this is going to be a continuing conversation. So with that, I'd like to turn this over to my co-host, who I'm very grateful for being here tonight, and Senator McGuire.
Before we get to our first speaker, there's a few individuals that we'd like to be able to acknowledge tonight We're grateful to the Humboldt County Office of Education and Superintendent Chris Hartley for donating the room here to the conference center. Superintendent, if you could just raise your hand and let's give him a round of applause. Thank you so much. We'd like to be able to introduce the Eureka City Council members who are here tonight. We have Ms. Burgell and Ms. Brady from the Eureka City Council. If we can give them a round of applause and they can please stand. Ms. Arroyo is also here tonight. I'm sorry, Natalie. There we go. Ms. Arroyo, if you don't mind, please standing. Thank you. Representing one of the best police forces here in this entire state of California, we have Eureka Police Chief Steve Watson here tonight. From the great community of Arcata, we have Councilmember Watson here this evening. Thank you so much, Councilmember. He has hit the ground running and is the hardest working sheriff in the entire state. Let's give a round of applause to the Humboldt County Sheriff, Sheriff Hansel, everyone. No one works harder than our district attorney here in Humboldt County. District Attorney Fleming is in the house. And we'd also like to be able to recognize the Department of Health and Human Service Director for the County of Humboldt, Ms. Connie Beck, is here tonight. All right, everybody ready to get this meeting started? We are honored to be able to introduce, coming to us live from the city of Sacramento is Ms. Perez. Marlise Perez has been the chief of Department of Healthcare Services Substance Use Disorder Compliance Division for 17 years. We also say she is the point person for all issues, the opioid epidemic here in the state of California. There is no greater expert in the state of California when it comes to opioid addiction than Ms. Perez. We're grateful that she's here. She's going to have 10 minutes to be able to give her presentation here tonight. I will give her a 1-minute prompt. We're then going to open it up for questions from Ms. Perez as she has another meeting to be able to go to this evening. We'll take 4 to 6 questions after her 10-minute presentation. Then we're going to turn it over to our local panel of experts, and then we'll take questions and comments at the end of their presentations. Does that sound like a fair format to everyone this evening? Yeah. All right, so without further ado, let's give a Humboldt County welcome to Ms. Perez.
Senator, and I really just want to recognize everybody that is there tonight. This epidemic is touching all lives, all communities, and I want to spend a little time just reassuring you that you're not alone. This isn't just facing Humboldt. Most of you probably already know that this is a nationwide epidemic. In 2016, over 64,000 Americans died from drug overdose, and with that, they're really looking at 2017 to have an even greater increase in overdose rates. So for Americans 50 and under, the leading cause of death right now is a drug overdose, which is startling as it's surpassing gun violence and other car crashes and other deaths. So in California, we obviously have the most individuals that have died of a drug overdose, which we're obviously very concerned about here with the Department of Healthcare Services. But what we're also concerned about is really looking at all the different roots of this issue. And unfortunately, what really happened in the nation with this epidemic is around prescribing opioids for pain. So unfortunately, a lot of individuals have walked in to their doctor with some sort of pain, perhaps in their back, and walked out with a very addictive prescription, and not knowing that, and ended up down a terrible road of suffering from a substance use disorder. And in California, just in 2016, there were still 24 million prescriptions for opioids given out in our state. And so these are things that we are looking at and really trying to help individuals understand how addictive opioids are. It can only take 7 days for an individual to become addicted. And then another really disturbing fact is 74% of people that use opioids have received them from friends and family. And so it isn't just receiving medications from doctors. It isn't just individuals that then move on and utilize heroin or other illicit substances like fentanyl. These are medications that start with a good purpose, but then can turn bad. And individuals, like I stated, can go down a very dark road. So we are very concerned not only in decreasing the supply of opioids, we are very concerned with the impact of fentanyl. So for those of you that are not aware, fentanyl is 50 times more potent than heroin. And the East Coast, their death rates have skyrocketed over the last year, mainly due to fentanyl. And individuals that do purchase drugs on the street, thinking that they're receiving an opioid, they are, unfortunately, a lot of the drugs are being laced with fentanyl. There have been instances where first responders, unaware of the danger of fentanyl, have overdosed just by having a few small little grains of fentanyl, and an individual can immediately overdose and stop breathing. So we're looking at the death rates across California, and unfortunately, they are up 540% due to fentanyl alone. So we are really facing a huge crisis of not only prescription opioids that are being abused, heroin, and fentanyl. We also have a big crisis of individuals that need treatment. And for individuals that have an opioid use disorder, nearly 80% of them do not have access to receiving treatment. But before I go into further of what we're doing, I really want to make sure that everyone understands that addiction is not a moral failing. It is a brain disease. It has been proven scientifically that it is a brain disease. Unfortunately, we do not know the root cause. We cannot genetically test and state that this individual may develop a substance use disorder, this individual may not. But it is not a moral failing, and we cannot arrest our way out of this problem. There's a lot of things that we can do, but we need to get people into treatment. We need to decrease the access of supply, and we need to educate because unfortunately, even those individuals that are suffering, they're scared to get treatment because of all the stigma associated with it. So a lot of these things we can all do and help with. And I want to talk to you a little bit more about what you can personally do at the end of my presentation. But first, I want to talk about what we're doing here at the Department of Healthcare Services. So we were fortunate to receive a $90 million grant from the federal administration. And so with that, what we have been instituting is the California Hub and Spoke system. So you folks up there in Humboldt County are receiving one of these systems. And Alex Dodd is going to give you a little bit more information about that later on in the panel. But we're very excited because just basically what it's going to do is provide more access to services, but also provide a lot of education, a lot of community support, working with the local opioid coalition with the goal to get more doctors in your community, learning how to prescribe, learning how to assist, and really supporting them in that effort. With that grant, we are also doing a separate project for our tribal communities because with opioids, unfortunately, the tribal communities suffer twice as high of overdose deaths as other populations. So we're doing some specialized work for those populations, and we're very excited to be rolling that out. And then another big project that the senator mentioned is we have received in California from our federal government a waiver to really shift our whole, how we deliver substance use disorders, our whole system of care. And so for your county, Partnership Health Plan is putting together a regional model with a total of 8 counties that we expect to see services beginning in the summer of 2018. One of the service areas that is required and that they're working on implementing is for individuals that have an opioid use disorder. So we really just want you to know that help is on the way. It's coming. It's coming in the form of the grant, also with this waiver. There's a lot of other work being done with the California Healthcare Foundation. So we're here. We really want to help in the form of education, and services, and once again, also really hitting that issue of stigma. So what I really want to just talk briefly about is, like I mentioned earlier, you folks aren't alone in this epidemic, and I want to highlight a state that has had a lot of success, and that has been the state of Vermont. So back in 2000, the state of Vermont had no treatment for individuals for an opioid use disorder. They were one of the, if not the highest leading state in overdose deaths. Unfortunately, they were kind of the poster child of this epidemic. And so what they did was they created this hub and spoke system. And so that is why we are replicating that system here in California. Now, of course, Vermont is about the size of our Inyo County, so we recognize that we can't just do a lift and shift, and we have to do it the California way. So we're, really ensuring that we can meet the needs of our diverse population. But we really have seen how successful it has been in not only decreasing overdose deaths, but also decreasing the rates of prescriptions, decreasing costs, and really building a community of care. So now Vermont went from having no services to now they have the highest in the nation. And so that is why we chose to implement that hub and spoke system here in California. And we are hoping and expecting to see some great results as well. So before I close, I really think it's imperative. I'm really proud that you came out to this meeting tonight and took time out of your evening to really talk about this important issue. But I would be remiss if I didn't make you walk away with some homework, because we can't do this alone. This isn't going to be solved by just the providers or the health system or the state. It's going to be solved by all of us. So I want to talk about a few things that you personally can do to make strides in decreasing the number of overdose deaths. I think one of the most important, like I mentioned earlier, that individuals, 74% of them are receiving opioids from family members and friends. It doesn't necessarily mean that people are just handing out their prescription bottle. This is, unfortunately, those addicted to opioids, obviously will steal them, so what you can do is dispose of your unused prescriptions. There's take-back days that you can participate in. There's also ways that you can effectively dispose of them in your home. So I would encourage you to go home tonight and look to see how many opioids do I have. You may not even realize that. And that will really go a long way in helping protect your family and your friends. You really need to talk to your kids about the risks of opioids. Unfortunately, there's a big trend underway right now with youth where they take any medications from their parents' closet, they put them in a bowl, they go to a party and they just take a handful and take those. And there's been a lot of overdoses, unfortunately, from these, what they call farm parties. So you need to talk to your kids. There's lots of resources about how to do that, but make sure you do that and do that right away. You could also participate in the local opioid coalition up in Humboldt County. It's called Prescription Safe Humboldt. There's lots of opportunities there where you can be an active voice in your own community and help be a part of the solution. And then also, if you have an individual or a loved one that is suffering with an opioid use disorder, I would encourage you to get naloxone, which is the life-saving reversal drug. You can, if someone is overdosing, you can administer it. It's in a nasal spray. You can spray it into their nose, and they can literally come right back to life. So if you have someone that I really would encourage you to get that naloxone. There's a lot of different avenues where that can be available. And then last but not least, we all need to reduce stigma for individuals that are suffering from a substance use disorder. Like I mentioned earlier, it's not a moral failing. This is a disease, and we need to stop making it be a moral failing because people need help, and we need to create a safe pathway for them to receive the help that they need. So thank you so much for allowing me to speak with you tonight, and I will turn it back to the Senator.
Thank you so much, Ms. Perez. Ms. Perez, give a round of applause, please. Ms. Perez, what we're going to do is we're going to start taking some questions from the audience. We'd like to go to see we have our first question. If you don't mind just stating your first name, and we welcome you. If you don't mind just standing up. Ms. Perez, here's our first question.
Hi, my name's Michelle, and I'm concerned about getting to the source of addiction, which is the studies have shown it's a lack of community. When people aren't connected to other people, it's so much easier for them to become addicted. And I'm not sure, you're familiar with the studies of the rats where they had water and cocaine and they were left alone, and then the ones that were together left the cocaine alone, but the one that was by himself just kept going on the cocaine till they died. And so that's that lack of not having any resources or help. I guess I'm thinking for the future addicts, but also for the ones that are trying to get off. We need to have more connection with them, a more literally human connection. I'm sorry. Yeah. So, is there anything being done to adopt that to get more connection? To get more connection.
Yeah, so glad you brought up that question. And one thing that is being done is across the state, there's now 36 local opioid coalitions, and they're really grassroots efforts. When the senator was introducing some of the folks in the room, those are the same folks that are parts of these local opioid coalitions that really create that sense of community to bring awareness, to get the number of prescriptions down, to help, break down some of those barriers, to help people get into services. And then also, it's when individuals are in services, creating that community for them. With the waiver I mentioned, we've added a new benefit called recovery services that really tracks an individual even after they've completed their course of treatment, to really connect back in with them so they're not alone, and to really help them in case they are triggered again or need further assistance. So, but I definitely agree with you. I think community is essential in order to prevent individuals from abusing the opioids in the first place, and then assisting them once they need help.
Ms. Perez, thank you so much for that. We're going to go to Pierre with our next question.
My question is, why aren't we attacking the source? Where the Senate and the Congress should be tightening down on the people who are producing these chemicals. Plus, my other thing is, here in Humboldt, we know where it's coming from. We know how to stop it, but our police are tied back, our hands are tied. What is your department doing? Are you allocating, are you going into the Congress and Senate and voicing your opinion on tightening up on these people who have all the money, that make money selling the drugs? Are you doing?
Thank you, Pierre.
Thank you so much for your question. We actually are part of a 22 department-wide around the state of working to combat the opioid epidemic, and part of that is the supply that you're speaking of. And supply in the sense of prescriptions that come from doctors, pill mills, illicit drugs like heroin. So we work collaboratively, just as one example, with the Department of Justice, and really looking and hearing what efforts they are doing to curb supply, because all of this information is very important. Just like the woman mentioned earlier, we need to do this as a community. We've really worked at the state level to do this also at a state level as a community. And there's senators such as Senator McGuire and other members of the legislature that have really been looking actively and passing legislation around this issue as well.
Ms. Perez, I think it would be, this is McGuire again, I think it would be fair to say there isn't a whole lot of action on the federal level in regards to curbing these opioids that have been coming in. Do you want to comment on that quickly?
Well, I can speak more to what has been done. They have been working on reducing some of the restrictions in the sense of getting more access to treatment. As I mentioned, the federal grant that we received, really looking at ways to educate doctors better so they understand that these medications are highly addictive, and other efforts like that. I apologize, I'm not as aware of what's being done on the enforcement end from the federal government to decrease the supply.
Mr. Perez, we're going to be going to John with our next question here in the back.
Yeah, I'd like to get an understanding of where you stand on, there's the source and then there's the people that receive the drugs. Now, we know for a fact now 60 Minutes has done their investigation and proven that Dan Marino, the congressman I ran against in 2012 back in Pennsylvania, is a primary source of supply and demand. The people, if you want me, I'm a licensed detective. I can go get you the addresses and the locations for each and every one of the drug manufacturers who lied to the doctors in '96 and are responsible for over 300,000 Americans dying. I mean, if the Taliban pulled this shot, we'd be in a major war. Now, you got the Border Patrol. Those poor guys are in a hopeless situation. I know friends of mine in the CIA. My sister worked with them. Guess what? The Taliban got rid of all of the opium in Afghanistan. Only our invasion caused it to come back, and we received 92% of that heroin comes from Afghanistan. Now, if the answer is, what are you going to do, or what do you propose we do, when, yeah, you said there's no federal response of any quote or any kind? What do we do? Because if that supply keeps coming the way it comes, how do you get people, when it's that easy to get off of it? How?
Yeah, so just to clarify, I'm just not really familiar with the federal response. I can talk about California's own response. I was just actually last week at a statewide summit for a lot of the state leaders, and the Department of Justice was talking about their efforts at the border. But you're right, it's very difficult, not only heroin, but with fentanyl, you just need a few grains of it, like the size of salt, to overdose. So it's very easy to bring that across borders. It's actually coming through the U.S. mail. They were describing how it even comes on postcards where people scratch it off. There's the dark web where people can order it. So it's coming at us from so many different angles. And while the Department of Justice and other law enforcement entities are stepping up to curb that supply, they're also stepping up and carrying naloxone with them. So in case somebody does overdose, that they can help revive them and also help get folks into treatment. So here at the Department of Healthcare Services, our primary focus is really helping educate doctors and prescribers, but really to provide access to treatment services.
Thank you so much. We're going to go to Draven with our next question.
Hi, I was just wondering if stigmatizing language such as tweaker and such would actually decrease a person's willingness to go out and seek treatment.
Yeah, so you bring a great point on language. Even the words addict can be pretty demeaning. And so that's why we talk about it's an individual with a substance use disorder. It is a disease. It's proven scientifically that it's a disease. Like I mentioned earlier, it's not a moral failing. But using words like you said about tweaker and other things, it's very hard for individuals in long-term recovery to step forward. They're fearful of potentially losing their job. They're fearful of the judgment they may receive. But we don't have that for individuals that need insulin and have diabetes. They're not afraid to come forward and talk about that. But we do have that stigma, and that's something else that we can all do is really watch our language of around this issue.
We're going to go to Ross with our next question. Then we're going to have two more questions in this portion, and then we're going to turn it back to our panel. Here we go, Ross.
All right. Ms. Perez, thank you for spending your evening with us. Virginia, I played Pee Wee football with your kids. Ms. Perez, as the California opioid expert, my question is in regards to the clean needle. I can't call it an exchange up here. It's more of a proliferation of needles. But can you enlighten us on the science behind that and the statistics that are supporting such a widespread use of needles?
Yeah, so I do, thank you for bringing up, I failed to mention about recognizing that there is a needle issue. We work closely with our partners at the Department of Public Health. They actually are more responsible for this topic in general. However, what I can say is individuals that are utilizing heroin and other opioids, their rates of HIV and Hep C are just skyrocketing. So we are very concerned as a state about those public health diseases increasing. And with clean needles, those incidents do decrease. And unfortunately, that's about all I can speak to about this issue. Hopefully someone else on the panel can provide more information.
I'm going to do a follow-up from Ross real quick, then we're going to go to Anthony. It's all good.
But what science would say that the same diseases could be passed via risky sexual behavior?
Yeah, so I apologize. I'm really not an expert on the needle exchange program. So I apologize. Hopefully someone else will be able to respond to your question.
We're going to get that to our next panel. Promise you we're going to go to Anthony right now with our next question.
Hey, thanks so much for coming out. I really appreciate it. I work in retail. I work almost every day. Harder than most. We're in front of the reverb there. So I'll get right to it. I try not to stigmatize. I try not to put people down, try not to make people feel like any less than what they are. I had a guy come into my retail shop. He stole $360 worth of merchandise. He had a meth scar right here. If I listened to the health department type people, though, I would have treated him like anybody else. And that's what I did. As a result, he got out the door. I couldn't catch him. He got to a rundown tweaker mobile, let's just call it what it was. He got away. You can go to my Facebook, you can see the pictures of it. $360 merchandise out the door because I was a nice guy. So here's why a lot of retail folks are here. A lot of people are actually working hard servicing customers. We want to reduce the number of criminal addicts. So in your talk tonight, at the panel tonight, please address how we can reduce the number of criminal addicts.
Yeah, so I think it's important to recognize that unfortunately individuals that are suffering from a substance use disorder, their cravings outweigh, issues like you're talking about of where normally those of us that aren't addicted to a substance, we wouldn't go into your shop and steal $300 worth of materials. But individuals, they're not in their right mind. I mean, they need assistance. And so really, I'm not advocating that you should let your person run out the door. I mean, that's why we do have law enforcement and other individuals when there are, things like that occur. But what we want to do is help prevent getting people to that point. And so really helping, once again, decreasing the supply and helping get people into treatment before things like that happen.
We're going to be going, thank you so much. We're going to go to our last question in this portion. Sir, I'm going to turn it right over to you.
Thank you so much, Honorable Senator, for being here. Thank you, Ms. Perez. Well, something has gotten us here, after all. This is a national opioid crisis, so coast to coast, border to border. And over the last 20-some years, handing out those needles, making it easier and easier for the addict, Proposition 4757, all those lowering the bar, or as I call it, cushioning rock bottom, has gotten us here. So for example, the notion of harm reduction is more like mercury bleeding into our watershed. It's a bioaccumulative process that has gotten us here. So the question is, don't we, by enabling the addict, we prolong the suffering. We know that that part of being a heroin addict is child abuse, child neglect, domestic violence, property crime, as we call it in Germany, the obtaining crime, obtaining money to feed the addiction. So isn't it at a certain point counterproductive to cushion the rock bottom, to prolong the abuse continuously? And so the question is, at a certain point, this opioid crisis is shredding away the fabric of our society via public spending, health risks, and environmental disaster with all the needles flying around, crime and decay. So shouldn't programs be based on accountability, full accountability of the addict to stop harming him and others? as well as transparency of the programs to truly have success rates. If we have a problem that constantly expands and doesn't shrink, our programs don't work. Yeah? If I run a company and I constantly run it into debt, further debt, I expand my debt, my company is not successful. It's a failure. So shouldn't we turn away from harm reduction and towards programs that are based on harm none, which means that the addict is being held accountable to standards of an adult human being?
Ms. Perez.
I do just want to clarify that the opioid has not started needles. There's a lot of evidence that it has started due to doctors overprescribing opioids for pain. And I think it's about 95% of all opioids are used in the United States. And so that has been what's gotten us to this point. And so unfortunately, for those individuals that then become addicted, which are senior citizens that go in for a hip surgery and come out with pain the pain medication that become addicted, young people, soccer moms, I mean, this is not sparing anyone. Then those prescriptions, maybe their doctor stops giving them, and so then they turn to heroin, which is much cheaper on the streets. And so that's really what is causing this epidemic. I really want to be clear about that. So what we want to do is for those individuals, provide them with help so they're not going into businesses and stealing money or other things that result from individuals that have an opioid use disorder.
So I think what we're going to want to be able to also hear is when Dr. Hunter talks from Open Door and Mr. Dodd talks from Aegis in regards to the treatment programs. Sir, I want to make sure that we get to your point when it comes to accountability and how that works, right? So if you don't mind making sure that we make note of that when we go to your program. If it works for folks, we're going to give closing comments to Ms. Perez, and then we're going to turn it over to Supervisor Bass to be able to introduce our next panel, which is focused on the opioid crisis at home. Ms. Perez, if you can have a closing statement, and we're grateful that you would take the time. You have 30 seconds, ma'am.
So once again, I just want to thank everybody for being there tonight. We all play a part. I really hope that you'll take heed to what I mentioned earlier, and all of you just really look and see what you individually can do to protect Humboldt County, and so we can get these overdose rates down and help your community. So thanks again, and have a productive evening.
All right. So we're going to move on. We're going to move on to our next panel. And see, opioid crisis at home, Humboldt County's response. We're going to hear an overview of the crisis in Humboldt County, challenges our community is facing, and solutions that are here now and coming in the future. And I'll give a brief introduction to our panelists, and then we'll let them take it away. Dana Murguia, native of Humboldt County, she was named Manager of Healthy Communities in 2015. She returned to Humboldt County after 15 years of outstanding work in program design, program management, training in human resources, and fostering buy-in with key stakeholders in the public and private sector. She holds her MBA from George Washington University, a bachelor's degree in English and Spanish studies, and a multi-subject teaching credential from K through adult learners. Is this microphone seeming strange to anyone else? Okay, good. It's coming in and out. And our second panelist is Dr. Donald Baird. He's a native of Portland, Maine, and a graduate of Dartmouth and the Medical College of Virginia. He served his residency at University of Minnesota at Minneapolis, where he also received his master's in healthcare education. He was appointed as the Humboldt County Health Officer in 2012 and has served in this role while continuing in private practice. So at this time, I'd like to turn this over to Dana.
Hi, everyone. My name is Dana Murguia. I oversee a division in public health called Healthy Communities that houses 11 different prevention programs. Can you hear me? Oh, can you guys hear me now better? Yay. So I oversee a division of public health called Healthy Communities, and we have 11 different prevention programs. I do want to say thank you to Ron Largusa, our county epidemiologist, who provided most of the information in these slides, and also Megan Montgomery. She's a health education specialist who designed them. In public health, we look at a lot of information related to rates of death and causes of death. It's important for people in this room to know that our mortality rates are actually 33% higher than the rest of California. And mortality is just a measure of the numbers of death in a specific population and for a specific period of time. So of course, when you see information like this day after day, you ask yourself the question, why? We came across a study done by 2 Princeton economists, and they coined a phrase called deaths of despair. They were studying the population of people who are considered middle-aged, 45 to 54 years old, and noticed that although mortality rates in the entire country were going down since the 1930s because of advances in living conditions and medical treatment for the 2 major killers, heart disease and cancer, that started to change around the year 2000. And that was because those progresses were offset by the numbers of deaths of despair. How's this sound? Okay? Okay. So in Humboldt, for the past 10 years, our rates of deaths of despair have been 2 times that of the state of California. And we're talking about those deaths of despair. We're talking about death by suicide, drug overdose, and liver disease and cirrhosis, or death caused by alcohol. So you can see on this chart, suicide rates in Humboldt are 2.5 times that of the state of California. Drug overdose rates 3 times that of the state of California, and liver disease and cirrhosis also 3 times the state of California. Another thing we do in public health is look at risk factors when we're trying to figure out why is this happening to our community. And many of those risk factors here are overlapping. Chronic pain is absolutely one of them that makes a person vulnerable to injury or disease. And when we think about chronic pain, it's important to remember that in Humboldt, our oral health is not always optimum. A lot of people suffer pain because of that. Depression, anxiety, and mood disorders are other risk factors. Early exposure to and use of alcohol and other drugs. Adverse childhood experiences or exposure to trauma. So adverse childhood experiences, I'm curious how many of you are familiar with that term ACEs. Okay. If you're not, there is a great website, ACEs Too High, where you can do your own ACEs check. And ACEs are things like, did your parents divorce when you were young? Did you often go without enough to eat? Did one of your parents have a mental illness, etc.? Another risk factor is access to lethal means. So not only are we talking about guns, we're also talking about prescription medication. So in Humboldt County, 31% of people have an ACEs score that is 4 or more, and that has absolute impact when it comes to having negative health outcomes. Someone with a score of 4 or more ACEs is 12 times more likely to attempt suicide, 10 times more likely to use injection drugs, and 7 times more likely to become an alcoholic. And twice as likely to suffer from things like heart disease, stroke, cancer, and diabetes. This information comes out of the Family Health Outcomes Project, which is a study done by UCSF. And you can see that it's possible for someone to have risk factors that make them susceptible to disease and injury even before they're born. So pregnant women in Humboldt are about 4 times more likely to be diagnosed with a substance use disorder. Another risk factor that you might not think about is our local economy. So our median household income is only 2/3 that of California. And so when there is low economic opportunity in a labor market at the point of entry, it has a cumulative effect across generations, and you start to see pathologies like social isolation that someone mentioned earlier, family dysfunction, addiction, and even obesity. So in Humboldt, our prescription drug rates for benzodiazepines and opioids are 2 times that of the state of California. If you were to calculate the total street value of prescription drugs from 2008 to 2017, it would be over $951 million. And we've already talked about the fact that there are far more opioids prescribed than people need, and so we can conclude that there is a thriving black market in Humboldt. It was mentioned earlier that we're not alone. I'll talk a little bit about that, but I want to show you a couple of numbers that were very startling to me. This is a number of people in the United States that dies every 3 weeks from the opioid epidemic, and it's equivalent to the number of people who died in 9/11. This is the number of people who died in Vietnam, and more than that amount of people died in 2016 from drug overdose. So, 2 minutes, got it. So we do have some great things happening in our community already. We are one of 12 communities throughout California to get funding from the California Department of Public Health to start the RX Safe Humboldt Coalition. And we're really trying to advertise this website, which gives people access to where they can find naloxone to reverse an overdose and where they can get trained. It also gives people access to where to find treatment, as well as links people to the RX Safe Humboldt website that has a great resource guide for alternative treatments for pain. These are just a few of the people who public health has trained in the last year. It's kind of small. So Humboldt County librarians, you've probably heard of, Arcata Police, HSU police officers, over 350 people essentially. And so in the last year, we've had 45 reversals reported. We want everyone in the room to know that we will have a free naloxone training on December 5th, and you can sign up outside at the table with alcohol and other drugs prevention. These are some of the community partners working on this problem. Cloney's has been an amazing advocate. We now have 6 medication disposal bins throughout the county where people can return controlled substances, get them out of your homes and away from your teenagers or older parents. Partnership Health has done an amazing job reducing prescription drug rates for people and patients who are on Medi-Cal. And again, RX Safe Humboldt has been great. So we want to encourage you to get in touch with us if you're curious about how to find naloxone or learn more about our prevention programs. And I'm going to turn it over to Dr. Baird, who will talk about some innovations that have been super effective.
How did we get in this mess? About 15 years ago, many of you remember, there was an epidemic of pain in this country. Legislators took it on themselves to mandate that every physician licensed in California would be educated to do a better job. We were required to take 12 hours away from our practices, 12 hours of Category 1 credit. Oftentimes you had to leave the area to do that. We learned our lesson very well. We increased our prescribing 4 times over the next 10 years, corresponding with an increase 4 times in overdose deaths. And as you've heard, 48,000 Americans died last year from drug overdoses. This year, that's projected to go to 60,000. That's just under 7 people every hour. We're doing our best with the partners that Dana has mentioned with RxSafe Humboldt, working with our own colleagues in terms of more responsible prescribing, documenting better that we're looking at function and not just the absolute pain level. Keep in mind that the people that have overdosed are our friends and neighbors. I keep hearing about all of these homeless people that were being besieged with these urban refugees coming in and flooding our community. Our data says something quite different than that. The vast majority of these people own homes, have been in this county for more than 25 years, and are approximately 50 years old as an average. That's every one of us could fit that profile. So going forward, I'm emphasizing the previous statements that we need to not vilify, not stigmatize. This is a community problem. We cannot do it alone. I'll be here on the panel to answer questions, and I'm taking notes in regards to some of the questions that were asked. My associate, Bill Hunter, will be talking about medical-assisted treatment and how we can get people to help understand and get off the drugs that got them in that problem. Thank you.
Thank you so much. Thank you very much, Doctor. We're going to turn it over to Supervisor Bass to be able to talk about the safe collection sites that will be distributed throughout the community regarding needles. Supervisor.
Thank you, Senator. The county has been working with many of our partners on bringing safe collection and disposal sites. We're calling them kiosks. We're starting out small. We've got 3, well, actually fairly large kiosks, but we want to see how those are used. We're working with community members to see where they could be best be placed. It's a little harder when you're working in government. We have to deal with issues of ADA and other things, so it'll be about 2 to 3 months before we actually get those installed, most likely. In the meantime, we are going to have numbers for folks to call because I hear from people frequently. I have a needle, how do I, what do I do with it? And we're going to be advertising those numbers. I don't have them with me tonight, so you can call them for safe pickup of needles that you're finding around. So the hope is by this collection program growing, we can also, combat some of the issues of disposing with needles when you find them. Because right now it's really hard. What do you do with it, right? So we're working with our partners, and we'll be excited, and of course we'll let everybody know when we're ready to roll those out.
Thank you so much. Thank you very much, Supervisor. We now would like to be able to go to our next panel. What we'd like to be able to do is move through our next panel along with Ms. Dugan, and then we'd like to be able to open it up for questions and conversation. Our next panel is Treating Addiction with Medical Care. We have Dr. Willard Hunter, who's the Medical Director for Open Door Community Health Center, and Alex Dodd, who's the Chief Executive Officer for Aegis Treatment Centers. Dr. Hunter joined Open Door Community Health Centers in 1998 and has served as their Medical Director for the organization. Alex Dodd is the CEO of Aegis Treatment Centers. They have 25 clinics in 15 counties throughout California. That $4.8 million that we mentioned that is now going to be advanced into Humboldt County will be opening up their 16th location here in the county of Humboldt, focused on opioid addiction as well. Without further ado, if you could please welcome, we're going to now first have Dr. Hunter, who are going to be given a presentation at Open Door. He will have 5 minutes, and then we're going to turn it over to Mr. Dodd, who will then have 5 minutes. Ladies and gentlemen, Dr. Hunter.
Thank you. Good evening. Thanks for having me out here. Yeah, I'm at the Open Door Clinic. I've been a country doctor in Humboldt since '78, and we respond to community needs, and this is one of the community needs we're trying to respond to. I'm going to talk about medication-assisted treatment. The World Health Organization, as well as all addiction experts across the country, have recognized that medication-assisted treatment is probably the treatment of choice for people with moderate to severe opioid use disorder. Medication-assisted treatment, if I talk about the medications involved, there's 2 of them. There's buprenorphine, which we use, and there's methadone. We started using buprenorphine in 2007 because there was no methadone clinic here. I don't know if I want to get into the pharmacology too much, but those medicines are really pretty different from each other. So what we did, our journey at Open Door was we started in about 2007, and we were having people who were just suffering. I mean, I was taking care of people whose every waking moment was dominated by how they're going to get their next fix, and they're getting abscesses, and they're sleeping out in the streets, and they're doing unimaginable things to get the next fix that they had to get. And when we were able to be licensed to use buprenorphine in response to that, we started with just a couple of people, and it was just the most amazing thing. I mean, I've done medical care in Humboldt County of all different kinds for almost 40 years now, and I haven't done anything that's been so predictably dramatic, so predictably helpful in transforming the lives of people who were desperately, desperately suffering. And I was just so surprised and amazed that one thing that really kept me going was there was a guy who had been injecting heroin on and off for like 40 years. He'd been in jail a number of times. He'd done lots and lots of things he was never proud of. And I had him on a buprenorphine, and he was getting his kids back. He was going to work. He was cleaned up. And he said to me, "Man, this is a miracle." And so I said, "What do you mean by that?" And what he told me was, I was clean before. I was clean for a long time, but for a year at a time, but every moment, all day long, that thing was on me. I just couldn't stop thinking about it. And it was work, absolutely hard work to maintain that sobriety all the way through. I can put one of these things under my tongue every day. I can go weeks without even thinking about it. I can get a job, I can take care of my kids. It's just remarkable. And this is a story that we hear over and over and over again. It's very moving, and so the reason that we kept growing is it was just so successful and so dramatic. So we grew our program. We developed this team-based approach, and so we had nurse case managers, and now we've hired some drug counselors. And so the way it works now is that we have 3 different phases of our buprenorphine program. We have, in the first phase, people come in and we see them every week. In a group every week. They often go to more than one group in a week, sometimes 2 and 3. The physician will see them each week and adjust their doses of buprenorphine. We do urine toxicology screenings looking for the accountability that we're talking about each time. And after people have been, if they peed clean for something like 6 weeks or 8 weeks, we stretch out the interval a little bit. After they're pretty good for a few months, we move them into our phase 2 group where people are meeting every other week, maybe sometimes every 3rd week. And then after people have been clean for a year or so, then we move them on. There is a little bit of controversy about this whole thing, right? I mean, some people believe that if you're taking buprenorphine or taking medication to assist with this, that you're not really clean. I think those of us that work in the field think that's really wrong-headed and wrong thinking. When we first started, we tried really hard to get everybody off of their buprenorphine in about 2 months or 3 months. And we were very aggressive about it, and we were successful, but our relapse rate was so high. We just had people back doing the same thing again. We had so many deaths in those years. So now we've backed off from that. We said, okay, we think it's better if you aren't dependent on us. And if you can get through that, we'll help you get through that. We've got a number of people completely off, but we let people take their own lead in that. So currently, it's a remarkable thing to me. Currently, we have something like 600 or 700 people that we're treating with buprenorphine through our clinic. A lot of people are coming to us a different pathway now through chronic pain. Am I running over?
You have about 1 minute, and I just want to make sure before you conclude, if you can just talk about, you just mentioned how many folks are coming through the challenge because of recidivism, right? And if you can just talk about that as well. But you have about 1 minute.
Well, yeah, I mean, not everybody is successful, but I have patients of mine that I've got for 5 and 6 and 7 years now who are functioning well, working people that you would never even know. People do fail sometimes, and we don't have the intensity that maybe a methadone. Methadone is a different drug. Methadone is a full opioid agonist. Methadone is more risky, requires more control, but it may be better for some people who don't thrive with the program that we have to offer. What we're doing now, the next phase for us is we're doing a couple of innovations. One is we're figuring out how to get people started in the emergency room when they come to the emergency room in extremis and in withdrawal. And we're also going to start a program in the next few weeks in the hospital at St. Joseph Hospital, switching people who come in there with problems related to their needle addiction over to buprenorphine while they're in the hospital. Then the other thing is happening now, what's to transition to our next speaker, is that and we don't quite know how it's going to interplay with us, is that there has not been a methadone program for addiction in Humboldt for a number of reasons, and that's about to change. And so we're trying to figure out in our program, how can we continue the momentum that we've got going and the service that we're doing, and meanwhile welcoming and working with our new cousins, as he says. So Alex is going to talk about Aegis and their presence in Humboldt.
Thank you so much. So as Mr. Dodd comes forward, there are now going to be two ways to be able to seek treatment for opioid addiction. Aegis has a different way compared to Open Door. He's going to explain that, give a brief history of who Aegis is and what they do and their treatment style. And then we'll be talking about timeline as far as being able to open up here in Humboldt with the 4.8 million. Mr. Dodd, the floor is yours.
Thank you very much, Senator. Thank you, Dr. Hunter. I'm officially your cousin. Gosh, you can prepare for a meeting like this, and then you're faced with 300 people in the room, and as the Senator said, show me your hand, somebody who's been touched or has a family member or a friend or a loved one touched by addiction, and many, many hands go up, and it's humbling. I think the place I'd just like to start is where we always try and work as a company, is thinking of the patient. And that's the person who suffers from opioid use disorder who we're trying to help. A couple of years ago, I asked a prospective patient, and one of our doctors in one of our clinics, if I could sit in on the intake and watch the doctor work their magic. I'm neither a doctor nor a clinician, but I think I'll get quite passionate about what we do. And I sat and watched the doctor do his intake of the patient. And when a doctor does an intake of a prospective patient, he does a physical and a history. And that can sort of tell me about how you got started using opioids. And at the same time, the doctor's looking in the guy's eyes or the girl's eyes for pupils, checking to see if there are any track marks for intravenous drug abuse. And the doctor does this, and at the end of it, the patient was admitted and so forth. And afterwards I said, "Doctor, thank you very much for letting me sit in on the intake. And by the way, I thought what you did was brilliant." And he said, "Well, Alex, I've done this 10,000 times. And I'd like to think that, I kind of know what I'm doing now." And then he himself was very humble, and he said, really, what I try and do is give the patient the skills and confidence to lead a drug-free life. And I think that's I hear the fellow who spoke earlier, give him a thumbs up. That I think is what we're all here to do. And we've sort of adopted that, if you will, as what we try with. We have about 660 employees, is we try and do every day. We remind ourselves our primary goal is to help our patients gain the skills and confidence to lead drug-free lives. As everybody has said, and I think it bears repeating and repeating, because as I think one of the panelists said, if we say something 7 times, we might actually learn it. The situation we face is an epidemic, and it is a disease. It's a chronic, relapsing disease of the brain. There are some people who still won't believe that. We'll say it an 8th time, and maybe you will. And it's a healthcare issue. Okay, so let me, I'd prepared a whole load of slides, but in the interest of time and fitting in, I'm just going to touch on a few of them. As a responsibility, I would like to say a little bit about Aegis and who we are in a very summary form. So who is Aegis? We're what they call a licensed OTP. OTP stands for Opioid Treatment Program, and we treat people who are addicted to opioids. And to Marlise Perez's fair point, I think over time we'll all try and drop the word addiction. We treat people who are addicted to, who suffer from opioid use disorder. And there are really 2 sorts. I think everyone knows, but it's worth saying. There are people who become addicted to prescription painkillers, Norco, Vicodin, Oxy, Tramadol, etc., and those who become addicted to illicit opioids, most notably heroin. 3 out of every 4 people who end up on heroin started with prescription painkillers. About 70% of the patients we admit, we say, "What was your primary drug of choice?" They'll cite heroin. But 3 out of 4 of them started. Some of them started using heroin. Most of them started with prescription painkillers, and then for whatever reason, when they either couldn't find or couldn't afford the pills, they ended up on heroin because it was more accessible and cheaper. We are, as Bill said, methadone, which is one of the 3 medications that are federally approved and that we use, is very highly regulated. We're regulated by Marlies and her army of colleagues, by SAMHSA at the federal level, and by the DEA. We're a very regulated industry. We have, Senator, we have 31 clinics. We must have added 6 in the last couple of minutes. We have 31 clinics, all in California. We're very, very dedicated to California. We have, currently our northernmost clinic is over the hills in Redding, in Shasta County, and we go all the way down to Wilmington in LA County. 2018 is our 20th anniversary. I suppose I should add up. We do a urine toxicology screen on every single patient every month. So we take a urine sample, and somebody once calculated how many urine samples we've tested over the last 19 years. It's a lot. We've probably treated tens of thousands of patients. But 2018 is our 20th anniversary. So I'd like to think we've gained some experience and know what we do. We have 660 employees. 250 of them are counselors. Our program is not really dissimilar in principle to Open Doors and Bill's. Medication-assisted treatment, that's what we use. In the words of one of our doctors, he says, medication is good, treatment is good. When you put the medication and the treatment together, that's the best. The medication, whether it's buprenorphine or methadone, really calms down the brain of the patient. It manages, have you ever seen anyone in withdrawal or cravings, whether it's for alcohol or heroin or methamphetamine? It becomes all-consuming, as Marlies said. So what the use of the medication does is it manages the cravings and the withdrawal symptoms, and it allows the brain a little chance to heal, and it allows the patient to be responsive to counseling. Counseling to try and understand why they use the drugs in the first place, and then learn the skills and confidence to lead a drug-free life. So we have a lot of counselors. We have 250 counselors, 24 doctors and medical providers, and about 60 nurses. And we care for 9,743 patients in our 31 clinics every day. Just to put that number in context, 4 years ago, we had 5,400 patients in 24 clinics.
Alex, I'm going to have you do about another 2 minutes.
Yep.
Having you go a little long just because it's new to the community, but I'm going to have you conclude in 2.
If I want to be reminded of sort of what we do, I always, again, think of the patient. And I put this image up there. This is a real patient of ours, a fellow called Tom in Lodi. He's given us all the releases so that we can use this information. Nice tattoos, good ink. And we interviewed him for our website, and he said, every day I wake up, I think how good it feels to be drug-free and how lucky I am to have found this place. I say that not just because it talks about Aegis, but really because the face you see there literally could be anyone in this room and anyone that we go to school with, our brother, our sister, our son, our parent. It's not, oh, the homeless or the them. It's as Dr. Baird said, it is everyone in the community. All right, so our intent, our mandate is to bring a clinic, a drug addiction, opioid use disorder treatment clinic. We'll use all 3 federally approved medications, Suboxone, just like Dr. Hunter and Open Door, methadone, which has been the gold standard for treating this disease for 50 years, and Vivitrol. Is federally approved medication as well. It's slightly different, but it'll be, when we open next year, we'll open out the door with those 3 medications. Historically, there's been a lot of stigma associated with drug addiction treatment and the methadone clinic, and I think we all have a responsibility to acknowledge that addiction is now really part of mainstream healthcare. And for patients to be successful and therefore impact positively everyone in the community, we have to treat patients with the respect that they deserve, whether they would be suffering from any other chronic disease. So that really means that a clinic's got to look somewhere where anyone would want to be treated, not some dingy place round the back. This is not our most recent clinic. It's a clinic in Ventura County, for anyone who knows that far south. We opened in April 2016. It looks and feels just like any modern healthcare facility.
We're going to have you conclude here in 30 seconds.
Okay. From the outside, it's a regular healthcare thing. Just a word then on the grant. Earlier this year, as Marlise said, the federal government administered some money. California picked up about $90 million. We were awarded $4.8 million, not for us to keep, but for us to distribute through into the county. And I'm delighted to say that the first check of that money we managed to get out this week to the RX Safe Opioid Coalition to help them with some of their initiatives. We've already started looking for a clinic. It'll probably be located within the sort of medical community, and we hope to open in the middle of, around about the middle of next year.
Thank you so much, Mr. Dodd. Round of applause. Appreciate everyone's patience. We're going to be opening it up for questions or comments in just about 5 minutes. But before we do, we'd like to be able to bring up Lisa Dugan. Many of you know her as the North Coast Regional Department Director of Child Support Services. But tonight, she's going to be speaking to us as a mom who's seeing addiction in her family, to be able to talk about those struggles and to talk about moving forward. So without further ado, we'd like to be able to turn it over to Ms. Dugan.
Thank you, everyone. Many of you do know me in my role as a professional, and yes, tonight I want to talk to you about something near and dear to my heart, which is my family. I never thought I'd be in this position. I never thought that my family would be in the position that they have been in. Last week, I had the courage to put on Facebook that I was going to come here tonight and I was going to talk to people about my daughter's addiction. And what happened from that just blew me away. I started getting not only people overtly supporting me right there on Facebook, but I got PMs, private messages from people that I've known for many years and had no clue whatsoever that either they or their son or their daughter or their partner was suffering the same addiction. We just don't talk about it. It's shameful and it's stigmatized. One of my friends that I grew up with said, you know, my son, he's suffering from the same I need to change my language from addiction, to opioid use disorder. And she said, you know, if it were any other illness, people would be bringing us casseroles. We wouldn't be so ashamed to talk about it. And we somehow need to get beyond that. We need to start thinking like other disorders, like bringing people casseroles so we can think about this and talk about this. So, you know, it would be easy for me to think about this as this is a them thing, and yet I can't. This is a we thing. This is an us thing. You know, each and every one of us here tonight, maybe one prescription away, maybe one trip and fall away from taking a medication that puts us in the same place. It seems that it's too much of a them thing. One of the things that I also do is I moderate McKinleyville Community Watch Facebook page, and you know, thievery is just out of control in our community, and much of it comes down to addiction. And these are people, you know, the behavior we can't condone, obviously, but you know, we tend to talk about them in terms of dirt bags and scumbags and terms that dehumanizes these people in our community that are one of us. So my daughter, let's see. This is my daughter. This is her shortly after going through treatment. Anybody here shop at Costco? Yeah? Anybody here, raise your hand if you shop there for 2 years or more? Okay, so many of you have probably actually met my daughter at one point or another. She was the very energetic, loving, kind, bright person at the front end who is, you know, running around, helping with orders, and a cashier. And she is one of the most kind-hearted people that I have had the good fortune to know. One of my proudest moments of her was standing in a line watching her cashier for a family, an elderly couple who had an adult autistic child. And Allison knew her, called her by name, pulled out stickers, and had a conversation with her that when that family walked away, they were just lighter than air. The sun rose and set in their daughter, and someone had taken notice. And that's who Allison is. And yet she's also the person who was given pills by a friend who said, here, take this, and this will make work easier. You know, jobs at Costco are very strenuous. They ask for a lot from you. And so she took those, having no clue what was down the road for her. So eventually, she started making things up. She got into a car accident, which never actually happened, so that she could go and get a medication for pain. She said she tweaked her neck at work so she could go get a prescription for pain. She manifested things that never actually really happened. She had 2 grandmoms who died while she was in her throes of this 5-year addiction that she helped nurse through to death. She had stolen a ruby ring from one, and she had stolen prescription pain medication from the other. So here's this beautiful person acting in horrific ways. She got to the point where her addiction, she needed to have pills at night before she went to bed, and she then again needed to have them in the morning when she woke up. So she started to have a very expensive habit that she couldn't maintain very well on her own. Sometimes the pills were $30 a day, or no, per pill, excuse me. She got the pills from people at work. Sometimes in the middle of the night, she had to get up and drive to Hoopa to get pills. She took her younger sister in back alley deals on the streets with people who were probably pretty darn scary and argued them down on the price of pills. Ooh, things that, you know, you just really don't want to know. So anyway, this went on, and she needed to continue to be able to keep the habit going and keep her job. And so she ended up taking up with a boyfriend who could help her with her habit. He also had addictions of his own, but he also had lots of money, so it helped her to be able to continue her addiction and continue with her job. And so she ended up doing things that she shouldn't have done that caused her to go to federal prison. And this is a picture of her and myself and my youngest daughter, who was eventually ended up in federal prison as well. So what Allison did was...
You have about 1 minute, 1 minute.
Thank you. Allison laundered money in a marijuana operation out of Ohio, and she allowed her boyfriend to use the bank account. And she did this because she needed to continue to bring in a lot of money to continue her habit. She asked her little sister, who's here tonight, to do the same thing, and as a result, they both ended up in federal prison. My oldest daughter, Allison, is still there, just about to get out here shortly. So really my message to you is this isn't a them thing. You know, those people that we call scumbags on McKinleyville Community Watch, they're actually our children. They're actually people who have been productive members of society. And I hope that we can, as a community, start having these conversations and stop stigmatizing this so that we can find solutions and support solutions that may sound scary, but I think we need to start getting beyond our fear, because we have a generation of youth that are at stake here, and you know, that's the most valuable thing that we've got. Thank you.
Lisa Dugan. So what we'd like to be able to do is open it up for questions and conversation. I know we're going to have a lot of questions, so we're going to ask each individual, if you don't mind just keeping your question brief, and then we're going to get right to the panelists. We're going to ask our panelists to be direct and also keep your response brief as well. The last item I'm going to say before we open it up is this is just the beginning. We are going to have another town hall just like this with an update about where we're at in either February or March. so that we're able to continue to move the progress forward. And I hope all of you would be willing to join us in February or March to continue to hold our feet to the fire and hold the community's feet to the fire to ensure that we have long-term solutions for Humboldt County. Are you with us? All right. So we're going to open it up right here to the gentleman. We're going to go to Joel, and Joel, Supervisor Bass will help direct the question. Joel.
Hi, my name is Joel McDonough. I am the founder, and for 40 years I was the executive director and the clinical supervisor at Humboldt Recovery Center. We were the primary contractor for the Department of Corrections and for local drug court. 45 years ago, more than 45 years ago, I was an addict and an alcoholic myself, but unlike some of the people that are referred to in this room, I was a scumbag. I would stick guns in your face. I was not a good person. And what I had to do is become one of those, and that's been difficult. What I do know is that if all a person does is overcome an opiate addiction, if they've been out ripping and robbing, they're going to also have to overcome that crime addiction, because you know what? Crime pays real well. That's why people do it. It's not true that crime doesn't pay. It pays very well, and I know an awful lot of people that have gotten clean and sober and continue to do criminal activities, and that needs to be addressed. Some of you know this already. Okay, I can't wrap up 40 years of experience quickly, so all I can say is if I'm ringing true with anybody here, please come and talk to me, because there is an alternative to simply trying to treat everybody like they're just fine and all they have is an addiction problem.
Thank you very much. We're going to go right over here, and then I'm going to come right back. Absolutely.
My question is to Dana. We've talked about the solutions that we need to have, and I think that what was not mentioned is the need to start very, very early, like in elementary schools and middle schools, because by the time they're in high school, you know, the land is set for them. So I really, really think if one doctor in the medical society said, we have sex education early in our schools, why can't we have drug education?
Thank you. So Dana, we're going to have you do a 30-second response. And again, not at all trying to be pushy, just want to make sure that we get to as many questions as possible.
Our time was limited, and I'm really glad that you brought that up. Our division recently was awarded what's called a youth prescription prevention program, and so we will be delivering a lot more services through that grant to youth, and the range of youth is actually up to age 25. So starting early. Starting early. Thank you for bringing that up.
What you learn in school is what you carry for the rest of your life.
Thank you. We're going to go to Art, and then what I'm going to do, since we have hands up in the back, I'm going to go to some questions in the back, then we're going to come to the middle. Art.
Hi, my name is Art Wilson. I'm the owner and operator of AJ's Transitional Living. And first off, I'd love to thank everybody for being here this evening and actually addressing that we do have a crisis going on in this community. We in the North Coast are really fortunate. We have amazing doctors. We have our new treatment facility that just opened up. We have a lot of things going on. And earlier, the woman on the board up there was talking about the hub and spoke system. What it's missing is an outer wheel. You know, I deal with people in recovery every single day of the week, 7 days a week. The people that come to my house, I don't have a limit on how long they can stay there. It takes usually around a year for people to get their feet under them. And they come straight from from treatment facilities. They come to us. We're a broad spectrum aid facility. We don't just provide housing. We take people to medical appointments. We take them to court. We take them wherever they need to go. My point is it takes a very long time for people to get their feet underneath them. The problem is there is no funding available for transitional living. We have a hub and a spoke and no wheel on the outside of it. We take people through treatment and put them right back where they came from, and their odds are almost zero of success. Thank you.
Thank you so much. So if it works, 30 seconds, I think one of the challenges that we have is that transitional living issue. Who would like to be able to take that quickly as we all look at each other? All right, Dr. Baird, quickly. Thank you.
You're absolutely correct. When you're dealing with a broken brain, a brain that doesn't work right, that's why they can't be accountable. That's why they can't hold down a job, because that addiction, that need for continual stimulus is there. And that's why most non-medical assisted treatments do not work. So having the support, having a roof over their head, having counseling is important. Couldn't agree more.
Thank you so much. We're going to come back here to Morgan in the very back of the room.
Hi, thank you for sharing the story about your daughters specifically. That's very brave, and I agree the shame needs to be taken out of this. I appreciate wanting to help these people. I do too in the future, but is there anything being done about the programs in the community that have strayed away from the give a needle, take a needle?
So if we can look in regards to the needle exchange, correct?
One of the programs I think is named Hatcher, and they just, I think in a very short amount of time have given out almost 500,000 needles and strayed away from that program that was instilled, get a needle, give a needle. And so I'm wondering if there's anything being done about that.
Thank you. County, do you want to touch base on that? Dana, do you want to comment?
Well, I don't want to speak for Hatcher. I think that people who have questions for them should visit the table that's out in the lobby and talk to them about their practices.
Ross, hang on one second. I'm sorry, sir. I'm going to come to you. I promise you. I'm not trying to be rude. We have a lot of folks who have hands up. I promise we're going to come right over to you, Ross. So please, Dana. Anything else you'd like to be able to say?
Yeah, like I said, I'm not going to speak for another organization. I don't have oversight of their operation, and I think that conversation is best had with people who work for that organization.
Morgan, I'm going to have a follow-up for our next meeting that will add that to the agenda. Is that okay with folks? And Ross, I got you right over here. We're going to go to our next question. Rob, we're going to come to you. Actually, we're going to go right over to Rob.
For Senator McGuire. We good? My question's for Senator McGuire. It said, or somebody said that the legislative people said that, managing pain was going to be one of the indicating factors for doctors, so pushed it that way. And then I guess my other question would be, what can we do to really hammer the pushers? I know you're probably not going to go with a death penalty like I would, but can we make it so if we catch these guys dealing these terrible drugs to these people that they never see the light of day? And I think that's a legislative thing that you could take care of, or at least start.
So happy to comment on that if that's okay. So just going to be completely blunt that we do have, as we talked about, Prop 47 and Prop 57 that passed by the overwhelming majority of voters here in California that limited sentences on values of drugs, anything $500 or lower, that would be an automatic misdemeanor. And that was passed by California voters. And a majority of Humboldt County voters as well. The reason why I say that is, candidly, I think it would be a challenge to be able to get amendments to that in the current state Senate and Assembly. There have been attempts at that. So for example, both on value of drugs as well as firearms. So if someone steals a firearm, supported that. But I do believe that it's going to be a challenge, and I'd be lying to you if I didn't say this, to be able to look at amendments. So that means there is another alternative to be able to put it back onto the ballot. There has been discussion about that, but again, I think where Californians are currently at is that it will be difficult to be able to pass with those amendments. I know you have a follow-up question, Rob, so please go right ahead, sir.
Yeah, I mean, that's fine. I think you're kind of copping out on that, right? You got to take a little bit of responsibility as
How am I
representative.
copping out on that, sir?
Because you're passing off on the voters, and I think you ought to be showing leadership and saying, look, we need to be driving this and selling it to the voters and saying, look, if you're dealing heroin or these class, whatever they are, drugs that these people get addicted to, you're going to never see the light of day. And I'd like to see some leadership from our representatives pushing things that way. You know, we've all basically come here and said, hey, you know, we don't want to call these people addicts and et cetera, et cetera. That's fine. And the gal whose daughters were addicted, that's tragic, and she was very brave to say that. But come on. You know, you guys are supposed to be the leaders here. Act like it.
So, sir, if you want me to stand here today and BS you and say, hang on, I let you talk without interrupting. If you want me to BS you and say, yeah, a bill's going to pass and we're going to be able to fix this, great. But sir, you need to be able to listen just like I listen to you. So here's the deal. It is going to be very difficult to be able to pass a piece of legislation in this state right now to be able to amend each of those propositions. If I said anything differently, I'd be lying to you. So I'm telling you the truth. So if you want to say that that's a cop-out, go right ahead. It's the truth. So then we go and try an amendment onto the ballot. I do not believe personally that that's going to pass. So if you want me to introduce a bill, or if you want me to vote for a bill, by the way, like I have, to be able to amend 4757, I will continue to do that. But it's not going to pass. And under the governor, who has made criminal justice reform as part of his legacy, and I think Jerry Brown has done a lot of great work, by the way, he will not sign it if it does pass the state legislature. And again, I'm not trying to be crunchy, but I just want to be truthful about it, that is where we're currently at. We're going to go to our next question.
A little different question, and this is for the my name's Julia. This is for the gentleman with the clinic Agus. I just wanted to know what kind of payers you would accept in your clinic, and when I say payers, as in Medi-Cal, private insurance, uninsured, and what your current payer mix is in similar locations.
Great question.
Okay, that's an easy one. With the current payers are mostly drug Medi-Cal, but private insurance, so mostly Kaiser Permanente and Kaiser in the south, Magellan, Blue Shield, Blue Cross, and about 20 other private insurance companies. And some patients pay cash, private pay, either for reasons of anonymity or because they don't have insurance and they don't qualify for Medi-Cal. Part of the $4.8 million grant funding coming down from the federal government through to Department of Healthcare Services, part of that money is available to help fund treatment, both for uninsured and underinsured patients. So somebody could have insurance, but they've got a big deductible or a big copay, and it's stopping them getting into treatment. Because what we all want to do is remove the barriers to treatment. So to answer your question, Medi-Cal, private insurance, and private pay, and that will be the same payer profile mix in the clinic when it opens here in county, supplemented by grant money, which can be used to make it easier for people whether they are underinsured or uninsured.
We're going to go to our next question with Rob.
Oh, okay. My name's Kathleen Bryce. I'm a criminal defense attorney. Before I came here, I had a meeting with a client who was in the throes of heroin withdrawal. I've lost a sister to an overdose at the age of 31. I lost a brother at 39 who died in police custody, but it was basically a DUI because of his cocaine addiction. So it's professional and personal. And my frustration on a daily basis, same as the officers in this room, fine officers that are here, is they're misdemeanors, a lot of them. Some are felonies. And, okay, so we've got them in the system, and then there's nowhere for them to go. They can't afford it. There's no money in probation. If it's a misdemeanor, there's no money in misdemeanor probation because it's unsupervised. How do we get people like the person I met with, who was so desperate before I came here, into where they need to go? And as far as the pushers, the gentleman over there, I think what we need to crack down on are the manufacturers, the ones that are making the money. And the law does that. Prop 47 doesn't relieve, the felonies are still there for manufacturing, whether it's marijuana, hash oil, or whether it's cocaine or whatnot. There's various levels of pushers, and most of the users, the people addicted, are also so-called pushing to support their habit. So putting them away and not seeing the light of day, that's not going to help us. That's going to be counterproductive. But yeah, the manufacturing, the law still makes those felonies, just in case you were worried about that.
No, thank you so much. Any comments from our panel quickly on this? Okay, we're going to go to Desiree with our next question.
I just have a question. I'm aware that this is a vicious cycle. Everybody's to blame and everybody's a victim. And what are we doing about our youth that are in high school? They're not in the system. Their parents aren't helping them. Are there services that they can get if they're addicted and they need help, but they're runaways? How are we going to address that?
Great question. Thank you. Panel talking about youth.
So I mentioned the RX Safe Humboldt website earlier, which has connection to county programs and community programs, and that's just a great place to go if you're looking for specific services for a specific population. I would highly encourage you to do that. You know, and I'm not sure if you're asking for yourself or for someone that you know, or you're just generally curious, but I would always encourage you to call us as well, 268-2132. You can just Google Healthy Communities Humboldt and you'll find us. Hope that answers your question.
We're going to go to our next question with Rob.
Hi, Mary. Just a quick, I wanted to make a few quick comments and then one question for the panel. I want to reiterate what I've heard here tonight about the importance of a holistic model of treatment, including reintegration into the community. I feel like that's something we can all do as a community to help people once they get the treatment. I'm thrilled to death to hear that there's more grant money coming down the pike into this community. I think it's going to be really critical, especially hearing about a new clinic coming in, to make sure that there's evidence-based outcomes on how successful the clinics are, and you know that this grant money isn't wasted. Every dollar is precious. The question I have for the panel, if anyone knows, do we know how many additional treatment beds will be available?
Can we get
Dr. Ruby Bayan is an addiction specialist who is now the medical director of the Waterfront Detox and Recovery Center. I'd like her just briefly to answer that question.
So I think it's important to be able to comment that there are going to be two types of treatment programs, right? One is podium. We're going to have you go to the podium. We have those who may be in treatment, or we also have day program as well. So I want to make sure that we also touch on the day program, but please.
It's our.
You want to introduce yourself, ma'am?
I'm Ruby Bayan. I'm an addiction specialist and a child psychiatrist too, and that's why I'm so interested in educating our young kids.
In your organization as well.
Our organization is Waterfront, and our executive director is John McManus, who's sitting there. And what we have is a 56-bed capacity program. 20 is for detox, medication-assisted, and 36 beds for residential. We take all sorts of insurance, including people who do not have insurance, and we detox them for anywhere from 7 to 10 days, after which we offer them 30, 60, or 90 days of residential. We have a whole, our program is evidence-based. It's dependent, we use the ASAM program in our own program. We have counselors who are drug counselors who graduated from CR. And we also have nurses who assist the doctors in the detox. And so far, since we started 2.5 weeks, 1.5 weeks ago, we've had 44 admissions. And this is both for detox and residential. And after that, we do case management, and hopefully we're able to have them learn some living skills. RCAA is going to be involved in helping them look for a job, search for community resources to help them, and hopefully even housing.
Thank you so much. If we can just, grateful, give her a round of applause. Thank you so much. 30 seconds, gentlemen. Aegis, if you want to just talk about, it's a little different. It's a day program, same thing with Open Door, 30 seconds each.
I think I described the basics of our program. I wasn't as clear to say that, as I meant to be, that the medication is really just part. The work happens in the groups. The patients, the people are bonding with each other, supporting each other, transitioning their lives and getting their lives back under them. The medication allows them not to be dominated by this need. That's what I wanted to say.
Thank you so much. We're going to go right over here to Ross, and then we're going to go to Rob with the next question. Ross.
So to the point of you are not alone, I heard that. I lost count of how many times I heard that from yourself included, Mike, and some of you others. I recently moved back to the area with my family, grew up here. In the matter of the last 3 months being here, my 3-year-old now knows what a needle is, knows how to identify a needle, feels responsible that he needs to protect his 1-year-old brother from not picking up those needles. So in what I'm hearing today, the entire solution to this is we're going to have 3 new kiosks. That's unacceptable. What else are we doing? I know we have elected officials in this room. We're all voting. And we as the people sweeping the needles off our front porch, fixing our windows that have been broken by burglaries, we want to be supportive of this entire operation. But as it stands right now, we're too busy cleaning our front porch. So what are you going to do, elected officials? Speaking of those ones that are sitting down and over here. Thank you.
Thank you so much. Supervisor Bass?
I think what I would say is, I said when I started speaking that we have the 3 to start with, the kiosks. There will be more. We're going to be working with different agencies, fire departments, to put them where they're easy to be, accessed by folks. Something I'd like to see is more I guess, I've been to a lot of businesses while I've been traveling where they have them in the restrooms. It's kind of weird at first, I saw it, but part of it is another option. I think the opportunity to have a number or several numbers to call, to have people come, but at the same time, it can't just be about that. It has to be lessening the numbers of needles on out in the community. And so I think that's something we really have to work on. I think my personal feeling is we do have to change some things in that respect, but I think we are. We're currently working on making sure there's less needles that will be out there. So I think it's going to take some time, and I do think this will be a follow-up and a great thing to have in February or March, to bring this back forward to see if we are having any positive benefit in that respect.
So does it work for folks to be able to agendize for our next meeting in February or March the issue of needles?
Yep.
Is it?
Yep.
Absolutely. So this does not preclude, obviously, local elected representatives to be able to move on that. The only reason I just brought up February, March, and I apologize, I didn't mean to disrespect saying that we would need to wait to that, just for our next meeting. But I think that obviously Board of Supervisors as well as City Council, I'm sure will be moving on that sooner. Is that fair in regards to that?
Yeah, we have concerns that we hope we'll see some action now, but if you want to talk about it again in February to see how we can make progress, that'd be great.
Absolutely.
Yeah,
Promise you that. Supervisor, anything you want to say on that?
No, I think that was exactly it. Let's start with what we're doing now and see what progress we see. And it's not going to be perfect. We also have an opportunity to have folks from the state come out here who were here earlier, last week, I guess, talk about the statewide program involving needle exchange. So I think it's a learning curve, and I think it's going to take a little time, unfortunately.
Thank you very much, and I appreciate everyone's patience. We're going to go to Rob with the next question. Rob, who do we have?
And this is Brandy.
I have a question about youth. I work with youth who are in transition age, homeless, at risk, runaways, and a lot of them are under 18. So I'm wondering, is the conversation started about how to provide services to minors? I know we're talking about education, but what about minors who I see on the street every day begging for help and don't have any options because they are afraid of contacting their parents or afraid of running into issues with law enforcement, that kind of thing.
Someone from the panel would like to be able to comment, please.
We're challenged with that. I'm not actually, maybe Dale or somebody knows what we tried to reach out to the youth in our clinic, and we try to offer them services, but the challenge that we run into is that currently require, for prescribing, for the medication-assisted portion, it currently requires parental consent, which is a barrier for a lot of these teenagers. They don't have to have parental consent for birth control or for STD treatment or something, but currently they still do. There's advocacy going on at the state level and beyond, and I think that's an important thing. If we could remove that barrier, then we could reach out with medication-assisted treatments.
Thank you so much. And I think another item that we should probably have for our next meeting is probably all issues of youth. Patty has been waiting patiently. Patty, if you don't mind, Chief Watson wants to chime in on the issue of needles and the efforts that have been happening in Eureka via the department and the City Council. Chief Watson.
Thank you, Senator. I don't want to say too much because it's not my place, but the question of needles has come up several times tonight. Certainly there's been a needle tsunami in our city. I think everyone would agree, and it's an issue that's very pressing in our community and very much in people's minds right now. So what a lot of people aren't aware is behind the scenes, there's been some work taking place, some collaborative work on this exact issue. A group of stakeholders have met twice so far to address this, and this includes the folks from the harm reduction programs in the county, Department of Health and Human Services, the City of Eureka. There were council members there, city manager and myself and others stakeholders of the various medical and service providers in town. And we asked some tough questions, addressed this issue, and again, it's not my place to say too much, but there was some acknowledgement that we do have an issue. We learned that there were some practices that changed in the last couple of years that may have contributed to the huge influx of needle litter in the city, including for a time going to a needs-based distribution of needles and away from a more one-for-one type of model. And there's some research behind that reasoning and why these needle exchange programs went to that model. We secured some promises or agreements for some changes in current practices that, if those are followed up on, I would expect would result in a fairly dramatic reduction in the number of needles in town. Not elimination. They're going to be around as long as we have the opioid epidemic that we have. But again, some acknowledgement that there is a problem and some willingness to be open to discuss this and make some changes. So again, it's not my place to go into much more detail than that. I hope that someone else will step up and do that in the near future. But I hope you'll see some relief because it is a problem and it does need to change.
Thank you so much, Chief. So, Chief, it sounds like there's more announcements coming here in the next 30 to 60 days, potentially? All right, so we may have some progress coming up. I'm going to go to Patty here. Patty, I'm sorry to keep you waiting.
For the people who know me, patience isn't one of my virtues, but I've been very good today, and you've been a wonderful moderator. This is a widespread group with a phenomenal turnout. I'm not sure where some of these people actually had to park to get here. But to the needle issue, I was operating and supervising a child care program in central Eureka over 15 years ago, and we had to sweep the playground each and every day for needles and condoms over 15 years ago. So it's not a new issue, it's just been brought to the forefront of concern. So adults need to become involved, parents need to explain explicitly, we've talked about education, what their children should do if they should encounter it. But my concern is the money that we're getting now is phenomenal. I'm excited. The understanding of addiction, if we treated it all like we treated cancer, I think it would be much different. If your child had cancer, you would not be afraid to tell anyone. I like that they would bring potluck dishes. I think that's very telling. But I am concerned that it's going to not be enough. It looks phenomenally good, but 45 beds with the amount of overdoses we have is a drop in the bucket. And what I have experienced within my own community, within my friends, within my family, within the parents that I served as a child care provider, where are we getting? How close are we? I don't think we're to 50% of treatment. You can't get pediatricians to come to Humboldt County. You can't, my aging physicians are all either retiring or, God forbid, dying, and I can't replace them, and I'm a normal, healthy, operating person. So I wonder what we are going to do within the medical community, within the community services field, the Board of Supervisors, the Chamber of Commerce, to make this a more inviting place to come economically, as well as continuing the pipeline of money to be able to support the services, or we're swimming upstream.
Agree. Patty brings up a good point. What I can just give you a statewide perspective, I'll do it 30 seconds, Patty, is that I think what you're going to be seeing coming up in January are additional investments from the state budget to combat the opioid crisis. The other item that we are continuing to work with on the federal level, while the federal government has declared an opioid crisis, they did not put any dollars towards it. And what we need them to do is to invest. So that's the other significant focus and push that we have to be able to fund that crisis that's moving forward. But the other item you will be seeing is about $2 million moving this year in 2018 to the County of Humboldt for No Place Like Home dollars, permanent supportive housing for chronic homeless, and wraparound services around each unit for drug addiction and mental health. So that's also moving forward in 2018. We could talk more about that here as well. Supervisor Bass, you want to talk about county perspective?
I think you were very good, what you said. The way I look at it, when you mentioned economic development, until we take care of some of these other issues in our community, we're not really going to get a whole lot of, as much of a bang for the economic development buck. I think what we're doing now is taking care of some of our problems and our challenges, and I think we're going to see the increase in economic activity. But it's kind of like all in, you're not going to get one without the other. I think this is it's a package. It's all related. But I think what the senator mentioned as far as the dollars coming out, I think that is really going to be helpful. And it's, like I said, we've got a lot of directions that we have to work from.
Thank you so much. Doctor?
One of the things that's striking to me is we're very happy we're getting a few $1 million, and I'm very grateful for that. But the elephant in the room is the amount of money in the whole drug industry. And I'm not just talking about pharmaceutical big pharma. This is Humboldt County. Probably close to $1 billion in the marijuana industry alone, fueling a lot of the other drugs. The chief talked about a tsunami of needles. I'm seeing a tsunami of drugs coming through this county. And it's really hard until we can match in some way the amount of money to treat what's being created by the criminal activity. And yes, sir, I agree with you. Crime does pay, or we wouldn't be having this problem we're discussing tonight.
No, thank you so much. Anyone else on the panel like to be able to speak? And then we're going to go to our next question with Rob. Rob, please.
Next question's from Ingrid.
Hi, so I'm wondering, I'm sure all of us would love to have a toolbox of how to start a conversation with our loved ones about how to seek treatment, how to recognize those things that we notice just aren't right anymore with the people that we love around us. And how do we address that with them? How do we get them to start the conversation that maybe they have an issue? It's not just denial, but how do we have that open conversation with the people in our own homes, in order to get them to acknowledge that there potentially could be a problem before they end up in jail, having boyfriends that are helping them to feed their addiction or otherwise.
Thank you, Dana.
So there is a website that has a risk tool that you can go through. It's called stopoverdose.org. It's kind of a creepy animation, but it's still very good, and the answers are surprising. It asks things like, do you consume opioids with alcohol, which is a high risk factor. And I think the value in a tool like that is it can open someone's eyes to how easy it is to put yourself at risk.
Yeah, I believe Lisa also had something she wanted to say.
Okay, I just want to ask one thing. Is there any reason why we could not start having more television advertisements giving the community the tools that they need as they're in the room with their children, with other people, like we did the Stop Smoking Sensations and other things like that? I don't want to see the boat going up the nose like we did in the 80s or that type of thing, because I don't know that it really worked. But I think having open conversations and giving tools to the family as they're sitting in front of the TV, and we're being barraged with all kinds of other advertisements that are so unbeneficial to our lifestyles. What can we do there?
We're going to need some quick answers on that, and if you don't mind, just so we have a lot of folks who want to still ask questions. So panelists, quick.
I think you should totally call our programs, because we can put you in contact with a couple of resources.
Dana, you want to give out the number?
The number is 268-2132. There's one starting up in Eureka very soon that sounds super promising, geared at youth as well, in addition to our programs.
Thank you.
Can you get the phone number one more time? There's someone asking.
So it's 268-2132, and you can just ask for the Alcohol and Other Drugs Prevention Program, or explain what you want, and our receptionist is great. She'll direct your call.
Thank you so much.
And I would add to that, don't stop having the conversation, and don't stay in denial. When you see things changing, point it out. Let them know that you still love them and will support them to get the help, but they will lie, they will deny, and it takes firm, loving, constant conversation to try to make a difference.
Thank you. We're going to go to Patty with our next question.
So my question, I'll get to my question in a second. I want to say I'm born and raised here 53 years, and I have never, ever seen a single needle until recently. 3 months ago, I saw my first needle, and it is shocking, and we do need to talk about it, and we need to talk about it sooner than February. We need to talk about it soon. So I'm hoping all our local officials are really, really ready to talk to us about it. I am new to this whole drug world. I don't have any immediate family. However, my best friend from high school just died last month from being an addict, and that's exactly what she was. So I'm learning a lot. So I'm interested. I think all of these things are wonderful. Our people do need help. Your people do need help. My question is, those that are on the street that don't necessarily want the help, how do we get them to you? How do we get these people off our streets and to you? I mean, do our law enforcement have any say? Does our judicial system, can they be court appointed? Because if they don't want to be off the street and get better, then I don't know how we're going to solve this.
So what a great question. We're going to start with Aegis. We're going to go to Open Door about how folks are referred. Then we're going to go to Waterfront. We're going to have a representative for Waterfront to please come to the podium. We're going to ask each agency to please give a 30-second answer. How do referrals work? How can we expand them?
Okay. Mike, do you want me to start?
Yes, please. Alex,
so,
I'm sorry.
Patty, I think it's a very difficult, complex problem, and I'm sorry that your friend didn't have access to treatment. You can't hear? All right, let's try it again. Is that better? Thank you. I'm sorry your friend didn't have access to treatment. because maybe if they had, they'd still be alive. I think the referral thing is a complex one, and I want to say about how people find us. It's almost 50-50 between being referred by word of mouth. Typically, somebody who used to suffer from the addiction. They hear from them, hey, I've got my life back together, maybe you should try it too. And the other 50% is from the internet. So a parent, and I know this happens because I've met parents of our patients who've done this, they'll Google, how do I get my kid off heroin? Or somebody who is suffering from the disease may say, dope sickness. Or they might Google methadone. So 50-50 that. And yes, it's got to be a whole ecosystem effort between law enforcement, corrections, judges, residential, outpatient, everything.
Thank you so much. Not at all trying to cut off. I want to make sure. So, Doctor.
I think that's a really hard problem what you bring up. I don't know that any of us have a great solution to helping people who don't want help. So I think that's awkward and difficult. What we try to do is find people at the point when they're willing to change, those teachable moments. We're moving in now into starting buprenorphine, for example, in the emergency room and in the hospital. If we can reach out in those ways, then I think we can make a difference. People come to us all the time. We have a waiting list right now. I think Dale told me like 15 or something people on the addiction side and 15 on our chronic pain side. We can get people in, and people find us. People don't know where we are at the Open Door. We've been doing it for a while. But how you help someone who's not ready for help is just a conundrum that every addiction group has had ever since I've known about that.
Thank you so much. John, we're going to have you do 30 seconds about Waterfront.
Okay, so what we're talking about is referrals, Mike?
Yes.
So referrals for folks that are on the street, they could come through Measure Z funding through the MIST program. Referral sources are Humboldt County AOD, Street Outreach Services. We have a contract with Humboldt County DHHS for indigent clients. We also receive referrals from AB 109, probation, and parole. And I do want to add something here. So the funding that's coming here is not funding that's coming for residential care. It does not add to the beds, what we are talking about right now. But there is more funding coming in. We have 3 different residential treatment providers represented here. We have Crossroads, we have Humboldt Recovery Center. We have all been, and I represent Alcohol Drug Care Services. We have all been struggling. None of this is new to us, and we have been working for years in an environment where we were woefully underfunded for the level of acuity of the clients we had. And what's nice about this, the Drug Medi-Cal organized delivery system, multiple ways to treat this issue, is there'll be more funding coming in. Drug Medi-Cal certification standards allow us to offer a higher level of clinical care. So this is very exciting times. And
John, we're going to need you to wrap up in about 15 seconds. I apologize.
Okay, it's just sitting here, I understand. We have people that work in this field, and we understand how the trials that these folks go with, the depth of what it feels like to detox from opiates. And we have community members that are just sick of getting robbed and needles in front of their porch. And as a property owner, I understand that. It's just, this is a complex problem, and we are all gonna have to work together. And one thing I do wanna say is when we talk about stigma, one of the best things to remove the stigma is anybody that owns a business and you have somebody that's graduated residential treatment and put the time in, looks healthy, take a chance on hiring them. Because for folks leaving residential treatment or any of these programs that they're on Suboxone, being self-sustaining is a huge way to maintain long-term sobriety and clean. So I thank you.
Thank you, John. Supervisor Bass. Quickly.
I think one of the things I wanted to mention to Patty's question is I think we lost the tool that was really important to us, and that was drug court. And I believe it was, Prop 47. I mean, there were some changes, so we don't have the tools to get people in to the program, which was actually very effective. how we bring that back, we've been talking about it and working. It's not an easy thing because it was one of those Prop 47 things. I believe it's Prop 47. Anyway, so I think that's something we really are looking at trying. How can we do it? Because that, to me, is the answer to your question.
Thank you so much, Supervisor. We're going to go to Sheriff Hansel as well about how referrals happen.
Thank you. Thank you, Senator McGuire, Supervisor Bass, the panel. This is really, really good to start of a discussion. One thing is, we have, in the past, we've had, our jail was full of people that have public nuisance issues, drug, alcohol, and I like to call it the gift of jail, that time when people have that moment of sobriety so they can actually go to a program. So they have to commit a serious or violent felony to get there, and there's still the drug addicted that do that. And so we do refer, probation, the DA's office, we do refer people to treatment programs. We do have programs in our facility now, more so than ever, to give people the opportunity to choose the right path. And so that is there. In the future, we have a jail expansion program. It's going to be a reentry program that the state funded through AB 109 money, $20 million. And so the last 30 to 45 days of a sentence are going to go into a reentry facility to get hooked up with programs, services, so they can be successful when they're on their way out. And because we know that if you wait till they get out of jail to start making good decisions, it's not going to happen. So while they're in custody, we want them plugged into that program, and which is going to include public health, Department of Health and Human Services with mental health treatment, probation services, AOD, all that stuff. And so it's got to be a 360-degree wraparound for people to feel supported while they're in custody. But I don't want all the programs to be for people that are in custody. There shouldn't be more programs in custody than out of custody. So what I hear is these treatment waterfront, what's happening with AGES, RX Safe Humboldt, all that stuff, it's gonna work. But we all have to work together on this. And also, one other thing, what I like hearing is that we can't just address the problem. How'd they get here? That's what we really should be looking at. Looking at 10 years from now. What are we doing for the kids now that's going to prevent them from getting addicted in the future? So that should be also a part of the conversation. And you know what? That's going to work.
Thank you so much. Sheriff Hansel, thank you so much. Rob, we're going to go to you for the next question.
All right, our next question is from Lorraine.
Hi. My question is actually, we're talking about the opioid crisis, and you all mentioned how we got there. What is being done for pain then? Because people come to you, and that's the first moment. They come with pain, and then somewhere down the line they're addicted. How can we change or use that moment of interaction when they come in pain? And as we probably know, the brain interprets physical and emotional pain in the same way.
Who would like to be a doctor?
Yeah, I think that's an excellent point, Lorraine, and I think that is true. What we've done at the Open Door is we've been trying to educate ourselves about multidisciplinary treatment of pain. We've been involved in a Project ECHO with some pain experts. We're trying to understand pain treatment as multidisciplinary, multifactorial. There's all different kinds of medications besides opioids that can be helpful. There's movement therapies. It depends on the kind of pain. Pain is not just one thing. I mean, there's back pain, there's neck pain, there's emotional pain, there's pain that's like everywhere from past traumas. And there are some medication programs completely separate from opioids that can be helpful in that regard. There's PTSD treatments with EMDR and counseling. There's acupuncture, other kinds of physical therapy things. We think of it as a multidimensional thing, and we're trying to increase our awareness and our power in that regard, and just not run to that opiate as the first and only thing.
One of the struggles we have, and recognizing opiates as the focal point, probably between, depending on the literature, 6 and 12%, maybe as high as 14% of the population are susceptible. Unfortunately, as the politics right now, the pendulum has swung so far that we're denying potentially 86% of the population who are not at risk of addiction. And we're learning we're learning each day how to tease that out. And there are indeed people who can responsibly take under a skilled physician's care opiates and not become addicted. The difficulty is in sorting out who those people are. And in our efforts, it has never been to get to zero. When we've talked to our colleagues, it's responsible prescribing to people that don't have those red flags, family history, history of alcoholism, history of substance abuse themselves, and getting to a safe dose where they're not at risk of overdose, and particularly in combination with other drugs. The most overdoses we have that involve opiates also involve multiple other substances, including alcohol, methamphetamine, and we use the term benzos. I'm referring to common tranquilizers.
Thank you, Doctor.
And what we've learned is
I need to go to our
Suboxone.
next question, and I apologize. If you just want to conclude real quick, and
Right.
let's go to the next question.
Suboxone or buprenorphine, they're the same drug, is equally effective for pain as it is for substance use disorder. It can be used for both.
And again, I just want to say thank you, everyone, for your patience. Not at all trying to be pushy. Just want to make sure that we get to all the questions here tonight. And thank you for your patience. I also want to say thank you to Stuart. Stuart runs the program at College of the Redwoods, who are training addiction specialists at College of Redwoods. They have a fantastic program, whether it's addiction counselors in Pelican Bay or throughout. We just saw at Waterfront today, College of Redwoods does a fantastic job. I think we need to give them a round of applause, please. Thank you. Stuart.
Thank you. I know we've been talking about Suboxone and methadone and agencies and things like that. I know we touched on Waterfront. Waterfront Recovery Services is incredible. It's been long overdue here. And I challenge our media that when they're covering Waterfront, that they don't forget Humboldt Recovery Center, that they don't forget Crossroads. The only article I've seen on any of these other programs was when there was a fire at Crossroads. They're not reporting what these other programs are doing. They're not even reporting what we've been doing at College of the Redwoods for the last 20 years in terms of the Addiction Studies program. We are part of the solution. We're providing the workforce for probably 80% of the staff at these programs, including out in Hoopa, as well as Del Norte County. And I really, because a lot of what we're talking about tonight are people asking questions, where do we go, what do we do? You want to be part of the solution? Come become a certified addiction counselor. You want to be part of the solution? Find out what you can do to help these other programs that are providing the treatment, not just the outpatient Suboxone and methadone. There's a lot of stuff that's been going on in this county for a long time, and I don't want them getting lost in the beauty of what Waterfront Recovery Center is doing. You're going to be hearing a lot of that. I want to make sure we're hearing a lot about the rest of it, and I challenge the Board of Supervisors to make sure you keep us in mind too.
Thank you so much. Thank you, sir.
Actually, in response to that question, when I came back and thought, hey, let's have a town hall, and knowing it was going to be continual, I would like to see many of these things, brought back, but a lot of the groups highlighted. It can be a whole different panel that's up here next. I mean, that's what we need. I mean, that's what I'd like to see us do. So I think there's great opportunity, and like I said, this is a long-term project for all of us.
Thank you so much. Let's go to our next question with Rob.
Next question is from Pierre.
Yeah, I got a question about after your program, we send our children, young adults, to what we call halfway houses, correct? We have halfway houses in Humboldt that I have no idea who regulates them. Nobody. And so the halfway houses become drug houses. And I'll tell you right now, you know how I know? I have two sons, right? Stepson and my real son. They were both referred by the police department, arrested separately, of course. One was older, one was younger. The police put them into a program. Several programs later, the younger boy, 32, my stepson, was found in a place where we were paying a halfway house, I say, halfway house in Humboldt, dead in an attic with the needle in his arm. His mother wouldn't even go down there to get him down. I had to go get him. And you know, every day that mom goes to the grave, waters it, mows the yard once a week with her mower. The sorriest thing I ever seen in my life. My other son, I almost said his name, he went to Teen Challenge. They put Jesus in his heart. And then he went to HRC, which I am forever endowed to. Good programs. And he works for me today. We've hired people from the programs. I think we hired 4. We still have 2 left. 2 flaked, went back to their old ways. But my question is, if we have all this money coming down, who's going to start regulating our halfway houses properly?
Thank you.
I got one more, and I just had a correction for Dana. I'm sorry, I don't remember your last name. Thank you for everything you did, but
We're just going to need to conclude, and I apologize.
Okay, one thing. You slipped a word in your demonstration up there. You added guns. Guns have nothing to do with that. What we're saying about the death.
I totally see how that could be confusing, but right.
Okay.
So I think the bullet said lethal means, and so when we're talking about people dying by suicide, yeah, thank you for letting me clarify that one.
So I think the other item, because I don't want to address where the gentleman was talking about, is some additional regulation. And one of the items that we were talking about at College for the Redwoods today as well is those transitional homes when an individual may also get out of prison or jail, and they need to be able to seek continued assistance when it comes to their addiction, need a consistent form of regulation and set of standards. And also, we just heard on the issue of halfway houses, I promise you, we'll have more to come if it's okay with folks, and I'm not trying to be coy or punt, but need to be able to get some additional information that we'll have to you in February or March. Would that be fair? And we'll agendize that for next. We're going to come to our next question here.
Hi. My question is for you and Ms. Bass. I really love the collaboration I'm seeing here tonight. I think this is going to be really important for our community. One way we need to also direct is our political direction. And you saying you're going to have another meeting here in February, March is way too long to wait, especially since AB 186 is coming up in January in the Senate, and I know you support that. Are you willing to go ahead and support that without the collaboration from this community and without knowing what's really going on here? And Virginia Bass, are you willing to go forward and support AB 186? I really would like an answer to that.
I'll tell you, actually, I've never said I support 186. What I said in any interview is it's a tool and other communities are using it in other places. I haven't seen the data yet. I don't close my eyes to anything that could be in the future. Quite frankly, I don't think this community is ready for it right now. I think there's a lot of work. So.
I wanted to follow up. I do support harm reduction when it's done correctly. In this community, it's not being done correctly. Okay? I will support a safe consumption site in the future if we can get this under control and we can really see some leadership in this community, which we are not seeing. Okay, we all want to be there, we all want to get there. So we need our politicians to listen to the community, not our panel of experts, not our harm reduction community. They need to listen to the community who's dealing with this every day. Are you going to support 186 in the Senate this January? And are you going to vote on that before you talk with us again?
Thank you so much. So if it's okay, just a real quick item on regards to AB 186, which is harm reduction sites, and that was passed as a pilot project across the state. Humboldt County was one of the counties that would that you could implement harm reduction site here in the county of Humboldt. Within Assembly Bill 186, it stated that it had to have an opt-in measure, meaning that when the legislature approves the bill, it would be up to either the Board of Supervisors if this harm reduction site would be placed in the unincorporated area of the county, or the city council, if it was placed in Eureka, to be able to approve it. It did not allow for an automatic approval just because of state legislation. So we are not sure if the Assemblywoman is going to be bringing it forward this year. It did not pass the Senate. I did support it. And if you take a look at my floor statement, number one, I said, because we heard from the county, that the county was not consulted before it was advanced, the county of Humboldt itself. And I did support it because it had an opt-in measure, meaning that there had to be local approval prior to the establishment of a harm reduction site being established, whether in the county or in the city. So then what we're going to see is the Board of Supervisors will be taking a formal stance on the bill here in the coming weeks, is what I have understood, potentially the next couple of months. At least that's what I'm hearing. And so what I will share with you is I'm going to wait to see where both Board of Supervisors as well as the City Council are at, where they're at on the bill. So, and I think what we're going to do is, I think what's going to be important is, I'll promise you we'll give an update. I do not believe that you're going to see the bill move prior to February or March. But if it does, I'm going to get your number so that we can make sure that we get, yeah, okay, absolutely. But I do not believe that it's going to be moving. And thank you so much. It says reject, don't inject. I appreciate that. All right, let's go to our next, and I do want to say, safe injection sites, we do have the data. I get it that it's very controversial. We do have the data that it does stem the spread of disease in communities within urban areas. So I also understand that what the dynamics here are in Eureka, but if we take a look at many urban centers where where these safe injection sites have been implemented, you are meeting with an addiction counselor. When you walk in, you are also getting additional needles, and we do see a stemming of disease once they're implemented in the county. So I just want to be able to give all sides to that, because I do also believe that there is some positive to that, understanding that the dynamics here may be different, but I will be working, promise you, with the Board of Supervisors and the City Council. So let's go to Rob. And we'll
Next
go to
question's from
please.
Michelle.
Hi. First of all, if anybody saw the front page today of the home that was shut down because the owner didn't make mortgage payments, but she was running a halfway house, and those women were thrown out on the street. And come to find out, they have no legal case to go after this woman. And, you know, the general relief is going straight to her. She's from Argentina, she's got a passport, you know, and it sounds like she's going to end up getting away with this. So I think regulations definitely need to be made to hold the people that are running those places accountable, because those people are at their most vulnerable, and here they've had their backs, you know, everybody's turned their backs on them. And the other thing I wanted to say is, has anybody looked at the Scandinavian countries, how they handle drug addiction, where they actually have them come into the facilities and they take the drugs, and what ends up happening is they aren't out looking to steal money. They can go to work once they have their fix. They go to work, they keep their jobs that way, so they aren't out on the street throwing their needles around. They can maintain some sort of sense of normalcy until, and what they find is that they get tired of this being dependent, and they break away, the ones that can. There's something like one out of, well, I think it's probably like 8% that just can't be helped. And that's, you know, that's a sad thing too.
Thank you. Thank you so much for your comment. Any comments from Supervisor or the panel? All right, we're going to go to Tom with our next question. And again, thank you for hanging with us, everybody.
Actually, I just have a really brief comment. Anybody who thinks that stiffer sentencing is a good idea hasn't been paying attention. We tried that. It didn't work. It got us right where we're at today.
Thank you so much. All right.
Our next question is from Connie Stewart.
Hey, I just want to let everybody know, I want to go back to the economic development conversation. The county is getting ready to redo its comprehensive economic development strategy. And last time we did it, when we went out to the workforce and asked what were the concerns of the community, substance use and housing didn't come up. So this year, there's a new strategy. We are actually going to do a public survey. We're going to mail 17,000 surveys, actually 22,000 surveys to Humboldt County residents, households, and P.O. boxes. If you get a survey, unfortunately it's going to come December 1st. If you get a survey, please fill it out. It's going to ask you questions about behavioral issues, about food security, about economic development, about how you feel about the future of this community. We need that data to help inform programs like the programs we're talking. So I know it's Christmas time and it's the holidays and it's crazy, but please fill out this survey and return it so our economic development strategy can be more comprehensive over the next 5 years.
Thank you so much. We're going to be going to Shannon here in the back.
Hi, my name's Shannon, and I'm currently an intern with the Humboldt County Correctional Facility, and I'm learning to be a mental health clinician. I've been volunteering and interning in the community for about 5 years now in the substance abuse field, and Stuart was my teacher, and I love him. But anyways, my question is, what are we doing to help, if we know that already that people who have jobs and are, contributing members to society are affected by these addictions, how come our programs aren't in the evenings or on the weekends or like helping? I feel like what I'm seeing is we're catching people too late. And I know we're hearing about like in the schools, and I totally am a huge fan for that too. I think we need prevention, but also I think if we just changed a couple things and had mental health clinicians staying a little bit later in the evenings and having opportunity for people to not have to say, hey, I'm on blackout for a month here in my program. I have to choose to work on my addiction or to help my family or to keep a job, and our community thinks that people are just lazy and it's the morals that why they're losing their jobs, but sometimes we're putting them in positions where they have to choose a job or treatment. So what are we doing in Humboldt for that?
Thank you so much, Shannon. So let's go to either Open Door to be able to talk about the issue of during the day, talking about at night, and flexibility with that.
Well, we have after hours, we have evening clinics, and we have Saturday clinics. And I worked last Saturday, and I had, 3 or 4 of my patients were all in there for abscesses for injecting drugs. We try to be available more times of the day. It's hard to get the groups going then because it's hard to get the staffing for evening. But we have an evening buprenorphine program.
I think just to echo that, I think I mentioned 4 years ago we had 5,400 patients across the state. We now have just on 10,000. I said 9,743. One of the ways we've been able to accommodate the need and respond to your very good question that substance use disorder doesn't just manifest itself between 5 in the morning and 9 in the morning, or only on the weekends when people aren't working. It's 24 hours a day, 7 days a week, etc. Is for clinics to be open throughout the whole day. We have, if you look at a distribution of our patients, some come in the morning, some come in the middle of the day, some come in the evening. So whether we can open, when we open next year, whether we can open extended hours straight away, I don't know. But the idea would be to extend the working hours so that, as Bill said, if a patient wants to come to counseling after work, we have to be able to try and do that.
Thank you. We're going to go to Waterfront quickly.
SAMHSA, of those people who are involved in addiction, has recommended an intensive outpatient program. We now have an intensive outpatient program with the AOD. I really think that we need another program to respond exactly to the people who are going who have families and who are working. And hopefully that's another program later on that we're going to be working on that I think is going to be very helpful.
Thank you so much. We're going to go to Aaron with our next question. We have about 3 more questions, time for 3 more questions, and we're running up. And again, thank you for your patience. We're running up on 3 hours, and thank you for hanging. But let's go to Aaron.
Thank you. Thank you all for being here too. Really appreciate the work you do. One of the questions I have, we've touched on it briefly, was mental health. We've got a lot of money coming down for addiction. I know our mental health, I mean, people are saying, we don't have mental health. We do have mental health care. My question to you is, are you familiar with Laura's Law? And I was wondering if it is ever going to be, if there's anything being done to have Laura's Law enacted in Humboldt County?
Why don't we go to Supervisor Bass first?
And I'm looking at Director Beck out there. We've brought it to the board a few times. We have discussed it. I think some of the challenges are that we're finding is with the requirements to provide services, go through Laura's Law, the costs are extremely high versus the very small number of people it would actually help, because it's not just for anyone you see walking down the street doing something that you might think is unusual behavior. There are really specific criteria for you to get someone in a program. But what we have been doing, and Director Beck, because I keep looking at her right now, we're trying to find out how do we do what we do better, and how do we bring in the people who that we can help them. So we have talked about it. It's not as easy as I'd like it to be, and so we have to do it a little differently. Like so many things for Humboldt County, a lot of programs that are in other communities don't work here because we don't have the funding, we don't have the mass of people. And I do see the senator standing next to Director Beck, so if she's got something she'd like to add.
This is Connie
we
Beck,
put a lot of thought into it.
Director of Health and Human Services for the County of Humboldt.
Sorry.
I'll just add to what Virginia's saying. The numbers are very small. The criteria is makes it to where we would see 1 or 2 or maybe 3 in 5 or 10 years, right? So it's not and it's a program that costs a lot of money, and so we would rather do what we do better, and that's what we're trying to do now.
Thank you. And Aaron, you're going to be hanging, I think, a little bit afterwards. I'm speaking for you, and maybe I can connect with Director Beck and Supervisor Bass right afterwards as well. Young lady right over here has been so incredibly patient. I just want to say thank you for staying with us. Right over here. Vicki, fire away.
Two things. You can't force somebody to get clean. They have to hit rock bottom. My parents tried to get me clean back in '91. It took until 2001. And I can say I've been clean for 16 years. So you can't force somebody to do it. And for the police department, have any of the police department officers here been affected with the fentanyl overdoses?
Why don't we look to Chief Watson here real quick? Rob, if you don't mind bringing the mic back to Chief Watson.
So you're asking if we've been impacted by fentanyl?
Yes.
Here? It's not something, to my knowledge, that we are seeing yet. It probably is here. If it's not here yet, it will be here. We're preparing for it. Our department will also be trained on naloxone soon, and we'll have those in our patrol cars, first of all, to protect our officers from accidental exposures, but also for those opportunities where we might be able to save a life. It's coming. I think somebody from the Drug Task Force might be able to speak more to how much we're seeing it in our community at this time. Perhaps the Sheriff.
Thank you. Let's go to Sheriff Hansel.
Yeah, this is one of the benefits of working with Brandy Wilson, harm reduction. If you haven't spoken to her, speak with her, because I had some issues and that kind of stuff. I spoke with her, and I still have some issues, but she's reasonable. And so, that's one thing. She's very reasonable, and she has reasons why she's doing what she's doing. But one thing is she has some inroads with people that said there's fentanyl out there right now. laced with methamphetamine, heroin, and we haven't seen it yet. But because of that relationship that we've established, there was drugs turned over to our drug task force, and we're getting it tested right now. So we'll be able to tell in the next week or so if there's drugs laced with fentanyl here in Humboldt County.
All right.
Yeah.
Thank you.
So we'll be not just a presumptive.
So real quick, we're going to wrap up with one follow-up question from Vicki. Then we're going to go to our last question. We have two more questions. Sheriff, real quick, the follow-up question is what precautions are, whether it's deputies or chief police officers taking in regards to that?
Yeah, so it's dangerous. So right now we have naloxone that we're trying to get through all law enforcement, not just to help with that, but sometimes there might be an accidental exposure to any one of us. To have that there readily available is really important. So we use universal precautions. We have gloves. We just think that all drugs are infected right now, and we can't be too safe because of that.
Thank you so much. Chief, is that a ditto? Anything that you want to add to that? If you want to come on up. Hang on one second.
The training on the use of naloxone, as well as the universal precautions that our officers use. We're actually in the process of updating our procedures internally on how we handle and test drugs in the department just to minimize the chance of an accidental exposure. Because it is a very real risk. Officers have been severely injured across the country by exposure.
Thank you so much. We have two additional questions. Doctor, really quick.
You know, we're not just talking about plain fentanyl. We're talking about veterinary strength, carfentanil, and other synthetics that are 10,000 times morphine. You heard from Virginia Bass, prescription dose of fentanyl is 50 times morphine. This is 10,000 times. A small bit of that powder in your hand can kill you in minutes.
Thank you. That is a sobering statistic. Thank you so much. We're going to go to our second to last question, please.
Hi, my name's Amy. I work in public health, community wellness center, and I 6 months ago discovered a really close friend of mine was deep into heroin addiction. I had no idea the signs or symptoms. I'd never ever been around it before. It was pretty shocking and traumatic. And my friend is currently not clean, which doesn't matter. But I sought out meetings for Nar-Anon for the friends and family of specifically not AA meetings. And there's only one in Arcata. And I went to that meeting. And I know it's not, I'm very new to the whole idea that I've been to like 3 meetings, but it's like, it's not based on promotion or it's based on attraction. There were 5 people there, including me at this meeting, and they'd been going for about 5 years. So as we all know, addiction is a community and a family disease. And if you're affected by it personally, loved ones, friends, and you need that support, we need to take care of ourselves as well. And part of ending that, the continuation of diseases to start to treat ourselves as well and to become well-versed in what that looks like in a family dynamic and in our community. And so if you need support, let's come together and let's find a way through advertising and whatnot, and let's increase these meetings, because there are thousands of people that have loved ones every day that are using or have passed away or in the process of both or developing an addiction, and we're just in our homes. So we need to come together and support each other as well and our loved ones that are suffering from it.
Thank you, Amy, very much. Let's go to the councilwoman for our final question. Then we're going to ask for 30-second closes from each of our panelists. Turn it over to Supervisor Bass, and we'll have a final word. Let's go to the councilwoman.
Councilmember Arroyo.
Thank you so much to all of you. This is really more of a wrap-up comment. I know I heard someone say, the city council are here. Let's ask them about a matter. So it would be just friendly reminder. It would be profoundly illegal for us to talk about a new policy in this kind of forum. We need to have that conversation at a council meeting. There are 3 of us here, so we're really here to observe and listen and hear from the experts in the community. And so I look forward to working with all of you who are here tonight. And community members, and just because we are silent in a certain forum, and hearing information doesn't mean that we're not working behind the scenes on it. As the chief mentioned, there's a multi-agency, convening around the issue of needles. I know that was first and foremost on a lot of people's minds tonight. So that is continuing to move forward. It might not be the actionable step that you're all wanting right this minute, but it is taking place, and we are here to hear you. So I just wanted to let you know, I know the City of Eureka has been not a part of the panel, and so I wanted folks to know that we're here and we hear you.
Thank you, Councilwoman. So I just want to say, once again, we are so grateful that all of you would hang with us for the entire evening. Thank you. Thank you for your feedback. Thank you for sharing your concerns. And there's a commitment on all of our part that we will be back in the first part of 2018 to be able to address these issues. Once again, that does not mean action will not continue to move both at the city and the county level. I promise you that, and I know that the supervisor is all over it. I'll have some closing comments, but why don't we start from Lisa and work to my left. Come on down to 30-second closing comments for our panel, and we'll start with Lisa.
Wow, I don't know what to say, except thank you for listening. Thank you for caring about the community, for caring for each other. I'm overwhelmed tonight. I'm feeling really hopeful from what I'm hearing from the panel members, from our elected officials, and from our community here. So I think this does need to happen, and we need to do it together.
Mr. Dodd.
Thank you very much for letting us come. Without wanting to put a negative spin on things, Senator and everybody, unfortunately the problem's going to get a lot worse before it gets better. There is few people in the audience don't like hearing that, but it is what it is. And there is no time to waste.
Thank you. Doctor.
I also appreciate the chance to be here and share what we're doing at the Open Door. We have a commitment to continue to treat addiction with medication assist. We have a commitment to continue to treat chronic pain with multimodality approach, to work with the coalition and to work with our new cousins from Aegis. And there's a phrase that we're coming to now that the opposite of addiction isn't necessarily sobriety. The opposite of addiction is connection. And connecting with people and connecting together is what we're all trying to do. So,
thank you. Doctor.
I'd like to give all of you a little bit of homework. If you haven't read the book Dreamland by Sam Quinones, he's a journalist from Los Angeles. He's done an incredible amount of research. It describes the addiction problem for the last 20 years in the United States. It's probably one of the best treatises I've read.
Thank you so much, Dana.
I just want to thank everyone for coming. It's so good to hear everyone's opinion. This is what we long for in public health. And I also want to encourage you to pick up a sticker, stop overdosehumboldt.com, and if you want to be part of the solution, I failed to mention earlier another coalition called Humboldt Allies for Substance Abuse Prevention, or ASAP. So we would love to have you there.
Thank you so much. I want to take a moment to say thank you to Supervisor Virginia Bass for her incredible work here in the County of Humboldt in organizing tonight's town hall. Great to partner. I know that we're going to be coming back together here in the coming months. Closing comments, please.
Well, one, I do want to mention Sam Quinones, the author he talked about, was scheduled to be here. He had a heart attack. He's okay. So we'll bring him back in the future. It's an excellent read. I'd say take a look at it before then. And I guess I'd close by saying, as I was driving over here tonight, I thought, what did I get myself into? You know, the crowds and what we're hearing in the community. I was excited, but I was also a little bit, I was a little concerned, you know, because I thought, is everyone going to be respectful? And I'm so pleased at the people who are here and the time we took to actually hear what each other thought and felt and what we're doing. And, you know, this is the beginning. There's a lot of work. You have my commitment. I mean, I've dove into this thing, and I find it actually quite fascinating. And I believe we have Senator McGuire, who we'll keep in touch.
Absolutely.
Like, often.
Sorry. No, thank you so much, Supervisor Bass. And my comments would just like to be able to end with this. We do have some challenges ahead. And candidly, we're behind. But we are going to be able to catch up. And by working together, we are going to be able to solve this. The one area that we cannot do is splinter. We have to be able to work together, no matter if we're coming at this issue with differing opinions. If we don't, we're going to continue to struggle. So what I would say is, you have a promise, you have a commitment that we're going to be back in this room in February or March, be able to continue to address this crisis that has hit Humboldt County, but it's hit every large and small city across our nation. There are going to be some follow-ups that I'd like to be able to throw out to ensure that we're all on the same page on expectations for our upcoming meeting. Number one, we're going to be talking about needle exchange and to be able to give you an update about where we're at on that. Number two, we've heard a lot about youth and how we can look at upstream investments, meaning starting early and being proactive when it comes to education. Am I right? Yeah. The other issue is that we've heard comments about tonight is those transitional housing units, whether you are transitioning out of county jail or out of federal prison, and some are halfway houses, some are treatment programs, but we need to be able to have a further conversation about standards for those. Is that correct? And then obviously, Assembly Bill 186, and keeping everyone in the loop in regards to that, and I know there are varying opinions on that issue as well. My bottom line is this. Humboldt County is going to do this. We are going to come together. We're going to have some tough days ahead, but I firmly believe with the city, the county, and the state working together, and all of us in this room, we're going to be able to improve the quality of life for all. A few thank yous tonight. I want to say thank you to the Humboldt County Office of Education for hosting us, and we're very grateful, and we've already committed them to give it to us for free next time. Like to keep it awkward. Want to take a moment and say thank you to the California Highway Patrol who are here, Eureka Police Department, and our hardworking sheriff, and I think we need to give them a round of applause and say thank you. I want to acknowledge Robert Christensen, who is our district representative, who works here in the Eureka office and is truly one of the hardest working people I know, who works in Humboldt and Del Norte, Trinity County. Where is Rob? And district representative, just want to say thank you so much to Rob. And there we go. I also want to say thank you to Carlene and to Taylor and to Jessica and to Tom Westlow for all of their work as well, who are on our team and cannot say thank you enough. And a round of applause for all of their hard work. I'm going to end it as we started it. Together we can do this, and we will. Wish all of you a wonderful Thanksgiving, happy Hanukkah, and a Merry Christmas. And come 2018, we are going to continue to make progress here in the county of Humboldt. Thank you all for hanging with us. We are officially adjourned. We'll be seeing you in February or March, and the Board of Supervisors will be back here talking about this along with the City Council. Thank you so much.